Good morning. I'm here.
Morning.
Good morning, Henry and Mayor.
Good morning, everyone.
Good morning.
Well, let me know when we have a quorum.
Good morning, Mayor, Council. If you can please turn on your camera so we can determine a quorum, that would help. Okay, Mayor, I see at least, 6, 7, 8. We have a quorum.
Let's call this meeting to order.
Yes, sir. Good morning. This is a special meeting of the El Paso City Council from Monday, August 31st, 2020. It is 9:01 a.m. Due to the pandemic, we continue with the video conference, teleconference formats for these meetings to avoid congregate settings. On the agenda this morning is the agenda review for the regular City Council and Mass Transit Department Board meetings of September 1st, 2020. And at the conclusion of this meeting, we will be convening a council work session. Mayor Margot is present and presiding. We begin with roll call. Mayor Pro Tem Schwartzbein. Representative Anello.
Here.
Hernandez. Hernandez. I think you're muted, ma'am. Morgan.
Here.
Rodriguez.
Here.
Rivera.
Here.
Lizarraga.
Good morning. Here.
Thank you. Representative Hernandez.
Good morning, Laura. I'm also here.
Salcido, thank you. I think Representative Hernandez might be having technical difficulties. I do see her on the screen. Mayor, we have a quorum.
Okay, let's begin with 3.1.
Morning, Mayor and Council. Terry Sharp with the Department of Aviation. Item 3.1 is a sixth amendment to the lease between the city and El Paso Independent School District. This allows specific improvements to remain after the lease expiration, specifically asphalt parking areas and some landscaping areas. We've agreed to allow those to stay after they vacate the property as a means of dust control.
Terry, are they going to be required to demolish the building?
Yes, sir. Yes, sir, completely. And then we've also added language in there to have a phase 2 environmental assessment done after they vacate.
Okay, what's their date of expected departure?
Tentatively in December, they should be out.
Okay. Okay, 3.2.
Yes, sir. 3.2, good news for the city and for the airport. United Parcel Service is signing a second amendment to the Air Cargo Center at 301 George Perry, Suite E. They are increasing their square footage from 97,100 square feet per year to 222,000. Our air cargo business is doing well this year. We're up about 5% on emplaned cargo. And this will take their annual rate from $90,000 a year to $184,000 per year.
Okay. 3.3.
3.3 is a First Amendment to the air cargo agreement between the city and FedEx at 501 George Perry, Suite A. This is, they're moving into Suite B for additional square footage for warehouse space and loading dock space. They'll be adding 6,100 square feet per year, and their rent will increase by almost $45,000 per year.
Okay. 3.4.
3.4 is a First Amendment to the baggage handling operations and maintenance agreement with Elite Line Service. We've asked for an increase on this reimbursable contract to take our yearly spare parts inventory cost from $15,000 up to $127,500. It's a large amount, but after 2 years into the project, we now have a better handle on what spare parts are needed. It's fully reimbursable by the airlines. They understand the necessity to have a good spare parts inventory on hand to eliminate any downtime on the baggage system, and they supported it at our airline meeting in July.
Okay. 4.1.
Good morning, Mayor and Council. Assistant Chief Z. Silva with the El Paso Police Department. 4.1, setting the standard for a safe and secure city. We're asking that the mayor is authorized to sign an interlocal government agreement between the city and the El Paso County, specifically the District Attorney's Office, for services that they provide to the police department relating to arrest and prosecution of criminal cases in connection with the DIMS program, District Attorney's Information Management System. The city pays 31% at $238,665.28.
Okay. Is this an annual agreement?
Yes, it is. We've been doing this since about 1995.
That's what I thought. And this amount is comparable to what we've been paying?
Yes, it's the same amount that we paid last year.
Okay. That's what I wanted. 4.2.
Good morning, Paula Salas from Purchasing and Strategic Sourcing Department. This strategic goal for this item is number 2, set a standard for a safe and secure city. The linkage to the strategic plan is subsection 2.3, increase the public safety operational efficiency. This is an interlocal agreement which will allow the joint use of the P25 public safety radio equipment and allocation of costs between the city of El Paso and the county. We are requesting for the mayor to sign a second amendment to the interlocal agreement. Again, this is for the interconnectivity regarding the P25 public safety radio equipment and the amended cost allocation for maintenance between the city of El Paso and the county.
Okay. 5.1.
5.1 are refunds exceeding the 3-year limit.
That's fine. That's right. I didn't pay attention to that. It's okay. 5.2 is
5.2 are struck-off properties.
okay.
When no bids are received at a tax sale, a property is struck off to the city. This item is requesting for council approval to place these properties for tax sale again.
Okay. 5.3, let's see.
5.3 is a waiver of penalty and interest, and it meets all of the requirements of the property tax code. This was caused by an act or omission of the appraisal district, and the full amount was paid within 21 days of taxpayer knowing of the delinquency. The written request was also made within 181 days of delinquency date.
Okay, 5.4.
Good morning, Mayor and Council. 5.4 is the update to the debt management policy. Say that again?
Would people please mute their phones if they're not speaking?
I lost it. Can you hear me?
Yes.
Okay, so the 5.4 is the update to the debt management policy. We did take it to FOAC a week ago. So I'm ready to present if you want to see the presentation, Mayor.
You want to present it now?
Yes.
Yeah, go ahead and present it.
Okay, let me share my screen. Can you see my screen?
Yes.
Okay. Okay, the goal for this presentation is goal 6, set the standard for sound governance physical management. Somebody's control, next slide, please. I wanted to share my screen. Is it okay if I share myself? That way I don't have to be asking.
That's fine.
Okay, so the background of the debt service management policy, again, is our roadmap for the way that we issue debt and account for it. We are intended to review the policy at least biannually, so this is the biannual review. This year, we're updating the policy for some cleanup and also to be in line with GFOA best practices and some clarifications. So we have, cosmetic changes for capitalization and clarification, but the main changes that we have this year is we link the issuance of debt to the capital improvement plan, technically to say, we issue debt because we're going to spend it in capital assets, not in operations. We also updated the length of the commercial paper. It used to be 270 days and it changed to 365. And you're gonna hear more a little bit about this one in the investment policy presentation coming up. So this is to be in line with that policy. We also added a paragraph on conduit debt and another paragraph on special assessment bonds, just because we have the Eastside Sports Complex and the PIT, and we want to make sure that we cover all that. Also updated the maturity levels for all bonds. It used to say 20 years, but we went back and we looked at our bonds, and technically that's not what we're doing in practice. So we changed it to the 25 years average. The use of the investment earnings, according to the bond ordinances, the investment earnings can be used either to pay debt service or to use it in approved and authorized projects. But we added a sentence, to actually says that council has to take action to decide whether they want to use it in debt service or they want to use it for construction for projects. We also added a clarification in regard to GASB 89, capitalized interest. So the way that this is changing is we used to capitalize the interest as part of the project cost. And now, according to the standard 89, we're supposed to report the interest expense as part of the debt cost. As far as the general obligation bonds update, again, we just changed the life from 20 to 25 years. Then we updated the paragraph in regard to the issuance of the bonds, because it used to say that we only issue general obligation bonds for 100 millions or greater, but that's not what we're doing in current practice. So we want to make sure that we reflect what we're doing. We also added the use for the public safety bond, since we have the authorization last November, and also to clarify the refunding bonds, because we use general obligation bonds to refund for refundings. Then updated the useful life of the assets. What happened is that whatever we buy with general obligation bonds is assets that are supposed to last over 15 years. And, with the quality of life bonds, we're actually buying vehicles and equipment, and those assets do not last over 15 years. So in order to be in line with the capital asset policy, we have to update this paragraph to include this exception. Also, we wanted to provide a distinction between issuing new debt for general obligation, which requires board approval, and also the refunding debt, which we also issue general obligation bonds, but it doesn't require the board approval. And the certificates of obligation, we just updated the life of the assets, because it used to read from 1 year assets. We don't have that. That'll be an expense. So we updated it to at least the 3 years, which is, IT equipment lasts about 3 years. In the refunding update, again, expanded the definition to include why we refund it, technically to take advantage of the market rates, and also reemphasize why it doesn't require the board approval, approval, and also added clarification as far as using escrow accounts whenever we do our refunding. As far as arbitrage, every year we have to comply with arbitrage requirements according to the IRS. And we have a company that comes and do the arbitrage analysis for all of the bonds, but we didn't have a paragraph that says exactly that we do comply with that. So we added that. We also added a paragraph as far as how do we acquire the service of arbitrage compliance, because we did have a paragraph for the underwriters and the financial advisors, the bond counsel, but we didn't have a paragraph for the arbitrage compliance services. And of course, we are complying with the SEC rule 15C2-12, and we want to make sure that we acknowledge that in the policy. And that's it, Mayor and Council. Do you have any questions?
Thank you. We're going to
You're
cover
welcome.
5.5, is that correct?
Yes, Luis Mier, our Treasury Service Coordinator, is going to cover that one, sir.
All right, I didn't hear. Council has not texted me with any questions, so let's go to 5.5.
Okay.
Good morning, Mayor and Council. Item
Wait
5.
1 second. Wait 1 second. Representative Hernandez has just texted me. She has a question.
I'm sorry, the message came in late. It's delayed. I'll have questions tomorrow, but I just want to clarify, do you have the red line of the debt management policy?
Yes, ma'am. It is updated. It's uploaded as part of the backup for the presentation.
Okay, I'll have questions tomorrow for this item. Thank you.
Well, this item is listed as part of the consent agenda. That's why we're covering it right now. You want
I'll
to
have
ask?
questions tomorrow, Mayor.
It's part of the consent agenda. Are you going to want to remove it from the consent agenda?
If I need to remove it from the consent agenda, I'll make a request for that during the revisions. Thank you.
Okay, 5.5.
Good morning, Mayor and Council. Item 5.5 of the agenda, resolution that the city hereby adopts the restated and amended City of El Paso fiscal year 2021 investment policy. The city's investment policy falls under Goal 6, set the standard for sound governance and fiscal management. Section 2256 of the Texas Government Code governs the investment of public funds. The section is known as the Texas Public Funds Investment Act. The act requires a written investment policy and a resolution adopting the policy. The investment policy was presented to the city's Financial Oversight and Auditing Committee on August 24th, and the committee approved and recommended it to council. There are 4 categories of changes. The first category relates to amendments from the 2019 legislative session.
Hold on 1 second. Do you have a presentation on this?
I do.
Okay, well, let's put that up and take this previous one down.
Lois, do you want IT to bring it up?
I was going to share my screen
Okay.
so I could navigate. I'm trying to, let's see.
We need to take the one down that's up there. There we go.
Okay. So again, the city's investment policy falls under Goal 6, set the standard for sound governance and fiscal management, specifically 6.6. Section 2256 of the Texas Government Code governs the investment of public funds. It's known as the Texas Public Funds Investment Act. The act requires a written investment policy and a resolution adopting the policy. The policy, again, was presented to the city's Financial Oversight and Auditing Committee on August 24th, and the committee approved and recommended it to council. There are 4 categories of changes. The first category relates to amendments from the 2019 legislative session. The second one is Section 9.4, divestiture of unauthorized investments. This was added primarily as a method for addressing donations of equities to the city. Section 10.6 is the manner and frequency that market pricing will be monitored. And then there are miscellaneous changes such as capitalizations, changing the word article to section, authorizing the use of electronic signatures when appropriate. And this would be intended, for example, signing the quarterly investment report. And that concludes the presentation.
Okay, thank you. Let's go to 6.1.
Good morning. Hannah Williams, Streets and Maintenance. Item 6.1 is a resolution to approve the designation of 43 offset angle parking spaces on Fort Boulevard between Copia Street and Justice Street to accommodate CID's Fort Boulevard Improvements Project.
All right, can we get the slideshow taken down? Thank you. Okay, 6.2.
This is Jerry DeMuro with Capital Improvement. Good morning. 6.2 is a request for authorizing a First Amendment agreement for on-call professional services for architecture, which is issued on a task order basis for the 4 consultants listed. The amendment is necessary to increase the capacity and to add federal funding clauses to the contracts so that the contracts can be used for task orders associated with CARES projects.
All right.
Mayor, I
6.3.
have a question.
Okay. Who has a question?
Cassandra.
All right, Representative Hernandez.
Hey, thanks for the briefing. Just really quickly, is the amendment to increase 100,000 for each contract? Specifically, those 100,000 would be CARES Act, or is it the total amount?
It increases each contract $100,000 and allows us to use the money for CARES Act projects.
Okay, but
So it doesn't necessarily have to be dedicated to CARES Act. At this point in time, we're actually in the middle of another solicitation where we're going to acquire new contracts for architectural services.
Right, I understand. So let me rephrase the 100,000. That's the allotment for the 4 architecture firms. That's the CARES Act allotment.
Each firm gets $100,000. It's not necessarily tied to CARES Act. Some of the consultants need the capacity to finish projects that they're working on. The others are involved in the CARES projects.
Okay, but there's going to be a new solicitation for specifically CARES Act dollars.
No, ma'am. The solicitation for on-call architectural services. These contracts are at their capacity, and therefore we're acquiring new contracts. But until we can get the new contracts in place, we're extending these or increasing the funding with these so that we can rapidly execute the CARES projects.
Okay, so I just want to confirm that the $100,000 is in fact going to go towards CARES Act projects. I mean, it's the CARES Act dollars, so there should be a direct alignment, right?
Yes, ma'am.
Okay, so yes, the about $400,000 will be allocated to 4 different architect firms for CARES Act related activities.
Yes. I don't think that's the case, is it? I think what's happening here is irrespective of whether they're CARES Act projects or projects that they're at capacity, the architectural firms. So there could be a combination of CARES Act dollars applied or other dollars to be able to utilize their services. Is that correct?
That is correct.
Right, and then the language says that will be applicable to task orders that will be issued for purposes allowed within CARES Act. So I just want to confirm.
The language actually just adds the federal clauses, the federal requirements. It doesn't preclude the funds from being used for other purposes. Right now, the contracts do not have the appropriate federal clauses in them to allow them to be used for CARES projects.
Okay. Thank you. I'm going to be I will request for this one to be pulled and out of the revisions as well.
As well, are you requesting the previous one to be pulled as 2?
Mayor, I don't have a question for you. That's why I haven't answered it, because I need to review it. So if I have questions, I will make a revision tomorrow.
Okay. Well,
Does that help clarify?
As well, it sounded like a plural, so I was just clarifying. Thank you. Okay, let's go to 6.3.
6.3 is
Mayor, sorry, Mayor, I just texted you. I don't know if you received it.
I'm sorry, I didn't.
I'm sorry. I think I used the wrong phone number. I have a question about what the conversation we were just having with Representative Hernandez.
Getting a lot of that.
Repinella, I can't hear you. You have feedback.
Yeah, I don't know. I think too many people have their mics unmuted. Yeah, Jay, I just want to know, I understand that we're putting in the language so these architectural firms and these contracts are able to utilize the CARES dollars. My question is, how do you justify that to the federal government when they do an audit of our use of CARES dollars?
The CARES dollars are used to design facilities for the vaccination and testing clinics, the public health laboratory, and the fire and logistics warehouse, as well as the COVID response center.
Absolutely, but you also just said that there may be overlap, and the architectural firms may also be using these for CARES Act projects and also for other projects. I just want to make sure on the back end that we are definitely going to make sure that it's 100% CARES Act projects that are using these dollars.
Ma'am, that is not correct. What these contracts are task order contracts. There is no guarantee that each contractor will spend the capacity that they have. We're increasing the capacity because 3 out of the 4 of these contractors do have CARES projects. Including the clauses in all of the contracts allows us the flexibility to have the architect that isn't right now doing CARES work to do CARES work if necessary.
Okay, thank you for the clarification too.
And also, Representative Vanello, honestly, only the costs associated with these projects utilizing the CARES funding is what's going to be charged to the project. And so whether it's a project related to the logistics building or the vaccination and lab testing building, the costs from these architectural firms, only those related to the actual project for utilizing the CARES funding will be charged to that project.
I was just a little confused about what Carrie had chimed in. It kind of made me think we were just giving them the money and seeing what they use for what. So just making absolutely sure that we're doing that. Thank you, guys.
6.3.
6.3 is related to 6.2. It adds the federal clauses to the architect contract with Mejadas Mora. Mejadas Mora was the selected architect to design the public health lab and the fire warehouse at the railroad building. Their contract has already been amended to add the cost.
7.1.
Good morning, Jacob Torres, Purchasing and Strategic Sourcing Department. This item relates to strategic goal number 8, nurture and promote a healthy and sustainable community. The linkage to the strategic plan is subsection 8.1, deliver prevention, intervention, and mobilization services to promote a healthy, productive, and safe community. The award of this contract will provide vasectomy services to the citizens of El Paso. This is a request for qualifications procurement for vasectomy services. It had 35 views. 1 proposal was received, 1 being local. An inadequate competition survey was conducted. No protests were received for this requirement. We request the city manager to be authorized to sign a contract 2020-548R, vasectomy services, Public Health Department, with Leo Lawrence Altenberg, doing business as El Paso Men's Clinic for vasectomy services for the citizens of El Paso and Hudspeth counties.
Okay. Section 8 are appointments. Section 9 is appointments. 10 is appointments. 11 is appointment. 12 are notations. 13 as well. Okay, 14.1.
Good morning, Mayor and Council. This is a request for purchase of family planning medication for the family planning clinic of the Department of Public Health. It is for a 5-year contract totaling $45,000, $385.20. This is a new contract. We have not had a contract similar to this in the past.
Okay. 15.1.
Good morning. This is Lisa Gala. 15.1 has to do with the lost dog conservation easement. It's an update to inform the public about our public input process, and survey will be rolling out. It also will let the public know about some upcoming dates to expect the conservation easement to move through the process to finish with legal and sign on with the Land Conservation Alliance.
Okay. 16.1?
Mayor?
Yes.
Sorry. Is there any way in terms of the survey to have those questions be able to brought up during the update tomorrow from staff?
I'm actually working on them right this second, so I hope to be able to update you within the hour or two.
All right, thank you.
Yep.
Okay. 16.1?
Yes, good morning, Raul Garcia, Planning and Inspections. 16.1 is a first reading of an ordinance rezoning property to R5 residential. This is for 6391 Domingo Street. This would allow the development of duplexes. There was no opposition, and City Plan Commission did recommend unanimous.
16.2?
16.2 is also the second reading of an ordinance. This is rezoning property to PMD, Planned Mountain Development. This is for property at 2300 McKinley. This is a cleanup just to match the rest of the property, which is already zoned Planned Mountain Development, and would allow the expansion of an existing assisted living facility. There is no opposition, and City Plan Commission did recommend unanimous approval.
Okay. 16.3. You're muted. You're muted. We can't hear you.
Good morning. Nelson Ortiz, Planning and Inspections. 16.3 is an introduction to an ordinance vacating 2 drainage right-of-way within Housing Authority property. The City Plan Commission did recommend unanimous approval on February 21st, 2019, and no opposition to the request.
Okay. 16.4.
Good morning, Mayor and Council. Kevin Smith with Planning and Inspections. 16.4 is the first reading for a renewal request for a special privilege license between the City of El Paso and the Naval Operations Support Center of the U.S. Navy. This license is for the encroachment of an existing security fence section along Truman Avenue.
Okay. 17.1.
Victor Carabeo with Purchasing and Strategic Sourcing, item 17.1, addressing strategy goal number 7, enhance and sustain El Paso's infrastructure network. The linkage to the strategic plan is subsection 7.2, improve competitiveness through infrastructure improvements impacting the quality of life. This is a low bid unit price procurement for bicycle connectivity infrastructure phase 2. There were 73 views online. 3 bids were received, all from local suppliers. No protest was received for this requirement. We're recommending that Pavement Marking LLC, authorized also under the name of PMI Pavement Marking LLC, be deemed non-responsive as they are not pre-qualified contractor by TxDOT as required, and that the contract be awarded as indicated to International Eagle Enterprises, Inc., the lowest responsible bidder. This award is contingent upon TxDOT concurrence of award.
Okay. 18.1.
Good morning, Ann Gallante, Planning and Inspections. Item 18.1 is the public hearing for a rezoning case for the property located at 3100 and 3106 Montana. It's for a professional office. CPC approval was unanimous.
Okay. 18.2.
18.2 is a public hearing for a special permit case for the property located at 12781 Edgemere. This is to allow a Sun Metro bus terminal. CPC approval was unanimous.
18.3.
18.3 is the public hearing for a rezoning case for the property located at 9050 Escobar. This is to accommodate a charter school. CPC approval was unanimous.
19.1.
Good morning, Mayor and Council. 19.1 is the annual assessment of the Public Improvement District. There is no changes this year. It was anticipated that the assessment was going to end during this year, and it did. We made the last payment in August 14. So there's no, we're not going to levy any assessment next year.
Okay. 20.1. Who's making that presentation tomorrow? Jessica? All right, let's skip to 21.
Yes, sir. I'm sorry. This is Jessica Herrera with Economic Development. I had technical issues, but yes, it's Lift Fund that will be doing a presentation over the impact of the survey that they administered to businesses that received the grants and loans in the last few months.
Okay. 21.1.
Yes, 21.1 is a request to allow for a waiver of the prohibition of sale of alcohol within 300 feet of a public school. This is for a proposed hotel or restaurant bar to sell beer and wine located at 1300 Airway. They were unable to obtain the letter from the district, so requiring them to come before council. That is all.
Okay, we can discuss that one tomorrow. 21.2. That's just the renaming.
Yes, sir. 21.2 was a city initiative of the entire length of Robert E. Lee Road to Buffalo Soldier Street. The City Plan Commission did vet this item on August 6th, 2020, and did recommend approval. We did get 8 letters of support for this item.
Okay, 22.1.
Good morning, Mayor and Council. Ben Fife with Parks and Recreation. 22.1 is discussion and action on a resolution to waive requirements on park facilities renaming to rename the Lomaland Community Center as the Sylvia A. Carrion Community Center. This was approved unanimously by the Parks and Recreation Advisory Board at our August meeting.
Okay. 23.1.
Good morning, Mayor and Council. Alex Huffman with the Capital Improvement Department. 23.1 is a resolution authorizing the purchase of 9566 Railroad Drive. This property acquisition is to help support the city's efforts responding to COVID-19.
Okay, 23.2.
Good morning, Mayor and Council. Robert Cortinas. Item 23.2 is discussion and action on the fiscal year 2021 budget resolution. Is to amend item number 21 currently in the resolution and to add item 73. Item 73 is a restoration of the wages that were lost as a result of the temporary pay reductions for our city employees. So you'll recall from May 24th through August 15th, city employees took pay reductions ranging from 1% up to 5%, depending upon the job classifications. So item 73 provides a one-time lump sum percentage adjustment in order to account for those lost wages during that time period. In addition to that, item number 21 amends what we discussed on August 18th and provides a lump sum payment for our professional managerial and our general service workers. So our professional managerial workers would receive a $400 for full-time with more than 1 year, $200 for part-timers with more than 1 year. And then our general service workers would receive $600 for full-times with more than 1 year, and part-timers would receive $300. So the executives, again, on item number 21, the executives would not receive the additional lump sum payment related to item number 21. And again, that goes back to the discussion we had back on August 18th. So it's a great benefit for our city employees who are working extremely hard right now during not only dealing with the health challenges, obviously, throughout the community, the financial challenges, but then also just the increased workload from, again, all of the vacancies that are unfunded. And so this is a great item. We're very excited, and we're excited to get this news out to our employees. And so item number 21, that lump sum payment will be made first. So our professional managerial and general service workers would receive that payment on September 25th. Item number 73, the restoration, the lump sum one-time percentage adjustment would be paid out on October 23rd.
Mayor Pro Tem.
Thank you, Mayor, and good morning, Mr. Cortinas. The item relating to the percentage adjustment, that wasn't discussed previously. This is something new that's being brought up. That wasn't discussed on August 18th, correct?
Well, it's been discussed in the past, and so the intention behind the temporary pay reductions was to, if possible, if the financial situation improved, was to essentially restore, to make our employees whole for what they had given up during that 12-week time period. And so what the recommendation does, but what this item does, the two items combined, it stays within the original 2.6 million that we talked about on August 18th. It provides the restoration, as I mentioned, that one-time lump sum percentage amount, and then provides additional payments to our professional managerial and our general service workforce.
Did we talk about a one-time percentage adjustment in the August 18th meeting?
No, but we've talked about that in the past, if possible, to restore our employees who sacrificed and gave up that temporary pay reduction during that 12-week time period.
Okay.
So this recommendation, these two items accomplishes, it's a win-win for everybody. It's, again, stays within the 2.6 million that we allocated, that was approved as part of the budget, and then provides not only the restoration, as I mentioned, but an additional lump sum payment for, out of the 3,600, it's over 3,000 of our employees that fall within the general service and the professional managerial category. So.
And the one-time percentage adjustment in terms of, it's essentially a raise, that would also affect, other, it's not a raise?
It's not a raise, it's a one-time payment. It's a percentage adjustment. It's the equivalent of what was given up in the form of those temporary pay reductions over that 12-week time period. And so our professional managerial, our general service workers took a 1% pay reduction, and so they'll receive a one-time percentage adjustment equivalent to that pay reduction that they took during that time frame. And that goes the same for all the job classifications that took pay reductions during that 12-week time period.
It's restoration, Robert.
It's a one-time percentage adjustment, yes, sir, to cover the restoration of the temporary pay reductions that employees took over that 12-week time period.
Okay. Anything else, Mayor Pro Tem?
No, sir. Thank you.
Okay. Do you all have any comments on 24? There's your items, Mayor Pro Tem 24.1, 2, 3. Before tomorrow, any comments?
No, sir.
All right, what about 24.4? Any comments there? Anything there? Wait till tomorrow?
Yes, sir. Thank you.
I'm assuming 24.6 as well. 0.7, 26.8, 26.9. And 24.9, excuse me. Nothing else there, Dr. Morgan, tomorrow?
No, just for tomorrow.
Okay. All right, let's move into the mass transit meeting. Let's begin with number 3.
This is Ellen Smythe, Managing Director of Sun Metro, and number 3 is the companion item for the one-time lump sum payment and the pay adjustments that Robert Cortinas just talked about.
Okay. Number 4.
Hi again, Victor Caraveo with Purchasing and Strategic Sourcing. Item number 4 addresses strategic goal number 7, enhance and sustain a fast infrastructure network. The linkage to the strategic plan is subsection 7.3, enhance regional comprehensive transportation system. This is a replacement contract for prefabricated bus shelters. The current contract expires on December 6, 2020. This contract will start on December 7, 2020. This is a best value procurement. 11 vendors were solicited, 0 local vendors. 4 bids were received, 0 from local vendors. No protest was received for this requirement, and we are recommending to award to Toller Manufacturing Company, Inc., the bidder offering the best value bid.
Okay. And 5 and 6 are presentations for tomorrow, is that correct?
That's correct.
Okay. All right. Laura, this ends the mass transit and the review. Let's.
Yes, sir. Can we have a motion to adjourn?
So moved.
Second.
There's a motion and a second to adjourn the agenda review meeting. All in favor?
Aye.
Anyone opposed? And the agenda review meeting for Monday, August 31st, 2020 is adjourned at 9:44 a.m. Mayor, would you like to move into the work session?
Yes.
Good morning. This is a work session of the El Paso City Council for Monday, September 1st, 2020. It is 9:44 a.m. Due to the pandemic, we continue with video conference and teleconference meetings in order to avoid congregate settings. Mayor Margot is present and presiding, and we begin with roll call. Mayor Pro Tem Schwartzbein.
Present.
Representative Anello.
Present.
Hernandez.
Here.
Morgan.
Here.
Salcido. Rodriguez.
Here.
Rivera.
Present.
Lizarraga.
Present.
Mayor, we have a quorum. I'll remind Mayor and Council, please leave your cameras on throughout the meeting so we can ensure there's a quorum. And staff, when you're presenting or speaking, please remember to turn on your cameras. The first item on the agenda is a city COVID-19 update, and we begin with an overview from our city manager, Mr. Tommy Gonzalez.
Good morning, Mayor, City Council. I'll start with the overview of the presentation that we're going to give as a group, the cross-functional team. So first, we're in day 172 of the response and recovery. As of 31 August, the recovery started 13 March. The focus has been to do a lot of testing and push that out. We have now performed over 225,000 tests across the community since testing began on 23 March. We have increased testing capacity by 1,400% during that time period, from 300 to 4,500 plus. We remain focused on expanding capacity and availability for our community. Our current increased capacity, again, now stands at 4,500 tests per day. Now, some of the partnerships that we've been able to forge, one of them includes UTEP. With their lab, they're processing approximately 800 tests per day in support of the Department of Public Health. The testing there began 17 August. They've tested almost 2,500 members of their community, faculty, staff, students. It's been free of charge. Processing has been on site for quick turnaround of results. They're further expanding the testing availability to our community by doing this, and the new reach into an important demographic to identify and address infections to reduce the rates in the young and the asymptomatic. So that was a big plus. Three other partnerships include, in the testing area, include the We Medical Labs. Services begin today on 31 August. Three types of service will be offered: walkthrough at a place of employment, and also home lab program. There's also additional 2 new labs, AIT and CPL. It's going to support the city testing sites. And there is also a new city testing site that's at Don Haskins Rec Center. I know that's been brought up a lot by the City Council, and we indicated that the number of tests would drive that, but it's also important to have geographic coverage. So this will get us coverage on the west and east side in terms of city-related facilities that we're managing. As you know, we have other facilities with partnerships throughout the city. The new site is at Don Haskins Rec Center on the west side. Service begins tomorrow, Tuesday, 1 September. So our current average daily testing is at 1,906 to be exact. And so the current trend across the state and nation is that the testing has been reduced. So it's important to remind everyone to get tested. I do want to kind of share with council some of the things that we've been doing to push out testing and having people be encouraged to test. We've had numerous focused campaigns that included Mother's Day, Memorial Day, Father's Day, 4th of July, and Labor Day will also be one that gets a lot of push. There's been media purchases, Pandora radio ad purchases, digital campaigns across all platforms. There's been a bilingual approach, ads in local newspapers. We've been also targeting messaging for 20 to 30s in that demographic, which is the highest infection rate, the asymptomatic and community spread issues. We've also been targeting messages for kids with our youth ambassador. Little Victoria has helped us with that. Social media pushes for all test sites and partners. We also have news media outreach that we've shared all videos, graphics provided to new outlets and encouraged to provide with public and feature that. So just wanted to point that out to make sure council knows that we have been pushing that out, and we know that the numbers have been reduced from the standpoint of, that's been a trend, but we've still been pushing out that information in order to have people encouraged to be tested. Let me get situated here. So the current situation by the numbers, total tests performed 225,155. If you remember the goal that the feds had put out, CDC, was at 5% testing. Obviously that surpassed that by a long shot. Total positive cases, 20,350. The infection rate is declining. Our cumulative positivity rate is at 9.04%, and our current 7-day rolling daily average positivity is at 6.65%. So positive cases continue to decline. Current recovery rate is 82.71%. It's up over the last report. The asymptomatic cases, 25% up over last report. Hospitalizations, ICU admissions, and vents continue to decrease over the last several weeks. As you know, we've worked with the business community in our economic response and recovery process with our staff. We're providing, we continue to provide for health and safety of our community. We also continue to support recovery and rebuilding of the economy. The 3 strategies that we've worked on with businesses have been to improve cash flow and liquidity, restart and continue operations, and invigorate the demand. There's been 11 community partners that we've worked with. There's 17 programs that we're pushing out. There's almost a little over $19.5 million in assistance. And the emphasis has been on safety. So with that, as you know, we've had that Pledge to Safety Plan program. It's voluntary, a self-monitored program. Local businesses commit to work safe guidelines. This has worked extremely well with the business community. We've worked with the chambers of commerce to push this out as well. It's been accessible to all types of businesses in order to promote public health through workplace safety and to build trust and consumer confidence. The sectors that we've worked on include restaurants, retail, construction, spas, professional business services. So some of the highlights with our community partners are the small business grants. Partners include People Fund, Project Vida, and Lift Fund. The Business Resource Clearinghouse and Bio Paso Marketing Campaign. We've worked on that with the Better Business Bureau. And then the Main Street Assistance, our partner there is the Hispanic Chamber. So we continue to introduce new programs. The Sun City Safe program includes our streets, businesses, and food courts, attempting to activate outdoor spaces and new ways to support businesses. That includes right-of-ways, sidewalks, partial street closures, outdoor seating. The Operational Support Program provides operating support to large nonprofit arts and cultural organizations. So this is a shout out to Jerome and Ben Fife. They put this in there to provide a season of activities open to the public and community outreach for cultural tourism appeal. So this supports organizational stability of El Paso's arts and cultural assets. So that's an important thing to do, especially when we want people to go out safely. The Museums and Cultural Affairs Department has awarded over $1.3 million, as you know, to eligible nonprofits and arts and cultural organizations for the last 10 years. So that's important to keep them involved and engaged. So as you know, due to the pandemic, current operating support program operations have been unable to provide in-person services and lost programmatic revenue. So it's important to work with these groups. So as we've said before, we need to continue to be vigilant and push the testing sites. And we appreciate you pushing that out through your email list that you have. And, getting tested is important. Staying home if you don't need to get out. Practice social distancing, wear a mask. good hygiene, get active. Our focus on wellness, the Live Active El Paso program has done really well. We've had a lot of community involvement. Taking an active approach to getting the community moving has been the theme of this program. We've been focusing on this because we want to push the idea of addressing underlying health conditions, including high blood pressure, diabetes, obesity. As you know, over 90% of those who have passed away have had these underlying health conditions. So it's important for us to push safety. Again, we're not saying that's the panacea. We're just simply, it's a good opportunity to remind people that that's something good to practice, good physical and emotional well-being, and preparing for, the continuation of the social distancing and wearing the mask. So the liveactiveelpaso.com website, we encourage you to visit that. So we want to thank the council for putting information out through their various ways, through their town hall meetings, and also through the different email distribution lists that you have. With that, I'll turn this over to City Attorney Carla Neiman for her portion of the briefing.
Good morning, Mayor and Council. Carla Neiman for the record. We have a brief update for you all. Is IT showing the slides? As you all know, we are now still under Governor Abbott's Executive Order G828 and 29. The governor has continued to extend the disaster declaration, and so have we. Later today, you will be once again extending the emergency declaration and extending the City Council's emergency ordinance. The good news is, for the first time, we have changed the language of the disaster declaration to note that we are decreasing the number of cases that are active. However, as you all know, we have to remain vigilant. We are also going to give you a brief update on the international bridges in terms of what is happening in terms of passage. And we will also be asking for an amendment to the proposed emergency ordinance regarding the City Council standing meetings. I will now hand it over to Anna Schumacher and then Wendy Vineyard, both Assistant City Attorneys. Thank you.
Thank you. Good morning, Mayor and Council. Anna Schumacher from the City Attorney's Office. As Ms. Neiman stated, I was going to start with regards to the update regarding the bridge. So as you all know, the U.S. and Mexico has continuously been in agreement with regards to limiting access to crossings to essential travel. And so back on August 14th, we, both the U.S. and Mexico, renewed that agreement, which would take us through that essential travel restriction through September 21st, 2020. Next slide, please. Thank you. The next thing that Ms. Neiman mentioned is that you all once again have for your consideration this morning the emergency ordinances. As you all probably could recite by memory now, El Paso City Charter 3.10b requires that those emergency ordinances be passed with the unanimous vote of council as well as the consent of the mayor. If we don't adopt these, then the emergency ordinances stand automatically repealed as of the 31st day that they were passed. Thank you. Next slide, please. So as you all know, currently we have two emergency ordinances in place. The first one is the extension of the disaster declaration that we have consistently reenacted, much like the governor did, since we first declared a disaster back on March 13th. The second is Emergency Ordinance 019036, which institutes certain emergency measures. As you all can see, this one looks a little bit different because not only have we reenacted it several times, we've also amended it several times. So some of the amendments that you all have included through the months, right, is that you all have changed the provisions with regards to restaurants, because at some point we couldn't even eat inside of a restaurant. And so we had to capture the changes as basically the guidelines changed on that. Similarly, some businesses that were closed for a long time are now open. Arcades at one point you all had to remove from remaining closed. Similarly, you all have changed the language with regards to boards and commissions so that they can now meet and are meeting virtually. Additionally, with regards to price gouging, you all took into account that the market just generally fluctuates with regards to fuel prices. And so you all amended that provision to exempt fuel costs. Additionally, you all have granted certain exemptions for the parking meter fees to enable curbside pickup at restaurants or at different venues. If these are not, the reenactment is not adopted today, these are set to expire on September 3rd. Next slide, please. So for your consideration today, we are including an amendment to Emergency Ordinance 019-62. And so this would allow, as Ms. Neiman said, work sessions and city council meetings to be held at the convention starting at 4:30 p.m. So one of the general amendments that we had to include is a suspension of and modification of ordinances and rules, because previously we only included that for ordinances. And the resolution that we would be suspending is with regards to the rules of order for city council. And so the changes that we had to make to accomplish this is, one, the references to 9 a.m. shift to 4:30 p.m. And similarly, with regards to call to the public, references from noon would shift to 6 p.m. If you all approve this, this would take effect on September 14th. Next slide, please. Thank you. So today, also for your consideration, is a new emergency ordinance, which is not included in the other two. This one would stand on its own, and it is essentially the creation of a pilot program for the use of the right-of-way. So the City Attorney's Office has been working with the Capital Improvement Department in developing what will later be described in more detail as the Sun City Safe program. And so this will allow businesses to use the public right-of-way to operate in a safe manner during COVID. This, along with the other emergency ordinances, requires the unanimous approval of council as well as the consent of the mayor, and it would also only be valid for 30 days unless it's reenacted. Next slide, please. Some of the things that our office has been helping with during COVID is also the continued support of HR. So most recently, some of the things that our office has helped with is to research and assist with the implementation of the lump sum payment that Mr. Cortines mentioned. We've also helped with the facilitation of the extension of furloughed employees' health insurance coverage. HR, as you all probably can imagine, has been fielding numerous questions from personnel with regards to COVID-19 and the workplace. And so we've also been helping HR answer and respond to some of those questions. And finally, we've also been helping HR with how they accomplish the reinstatement of some of the furloughed employees that we can bring back. Next slide, please. And with this slide, I'll now pass it on to my colleague, Wendy Vineyard. Thank you all.
Good morning, Mayor and Council. Wendy Vineyard from the City Attorney's Office. The City Attorney's Office and the Prosecutor's Office is providing ongoing training to the city enforcement teams and to EPPD and ESD officers and inspectors in training for the city's COVID-19 pandemic emergency ordinances for the state and the city of El Paso. At this time, training videos are also being prepared on how to functionally enforce COVID-19 rules throughout our community. The training also provides guidance on how to review federal, state, and local emergency rules in an effort to minimize potential conflicting rules between the various governmental entities throughout the city and county of El Paso. The training also addresses how to file a complaint with the municipal court. There are a myriad of governmental entities throughout the city and county of El Paso, and they may be subject to their own guidance or rules. For example, the school districts follow the Texas Educational Agency guidance. These training outlines how to identify what rules apply to each governmental entity. The trainings are adjusted as new rules are adopted. This ends our portion of the legal presentation, and now we're ready for the next presentation by Chief D'Agostino.
Thank you. Good morning, Mayor and Council. This is Chief D'Agostino. I'm gonna be quick this morning. We have a lot of people reporting out some good information today. I'm happy that they will be going over the new dashboard with you all this morning. This dashboard will allow the community to follow the scorecard that was set up by our task force. It's very interactive. It's gonna be very insightful for everyone, and I think you all are really gonna enjoy it. One other point I wanted to talk about is we have done some assessments. We've sent some Greenbelt teams out to do some initial assessments of our drive-through testing facilities, both our city site as well as the state sites. We've gotten our initial reports back from them. There was definitely some quick wins, some areas of improvement, and we'll continue to look at them as we go forward. I did get some reports from people getting tested this Saturday, and they got the results back on Sunday. That's great news. I mean, that's the power of the partnerships that this CFT and the task force has gone through with getting local laboratories on board, and as well as the UTEP, as Mr. Gonzalez talked about, those UTEP testing their community is our community. And so that's very helpful for us as we go forward. So with that, I'm going to go ahead and pass it right on over to Dr. Ocaranza, who can start off with the team lead out reports.
Good morning, Mayor and Council. This is Dr. Ocaranza. To give an update on the situation of COVID-19 in our community. Next slide, please. Next slide, please. We are very happy and cautiously optimistic about the situation of COVID-19 in our community. Most of the indices have been coming down, and after a peak that we saw, 41.5 cases per 100,000, now we continue to see a decline, and we're in about 11 cases per 100,000. Our doubling rate for the positive cases continue to increase, which is a good indication, as well as the infectivity rate has been decreasing. And also that gives a good indication that this speed at which the virus spreads in our community has decreased as well. Our positivity rate, as mentioned by Mr. Gonzalez, has been getting lower, and currently on CDC week number 34 was about 6.24%, and as CDC weeks end on Saturday night, we continue to update that information. We are very excited how we're going to be presenting all the information in our new dashboard, which is going to be interactive, and people can get information at the tips of their fingers. Hospitalizations, ICU, and ventilatory use has decreased also for several weeks. Next slide, please. Which we will see in the following slides, in which the graphic representation of all these indices is going to be presented to you. The asymptomatic cases has continued to increase, and initially was about 20% or 1 out of 5, and now is getting close to 1 out of 4 people are asymptomatic. One thing of note is that those asymptomatic cases can spread the virus to others, especially to those that are considered vulnerable ones. And we have been repeating over and over and over the situation and the dynamics in which the asymptomatic patients play a big role in the spread of the virus around the communities. We continue to advise the community and members of our county, especially those that are considered vulnerable ones, to continue not letting their guard down, because we don't want to see them affected by the COVID-19, and in the near future with influenza or influenza-like illnesses. Respiratory viruses are going to be circulating in our community pretty soon, and usually we start seeing the start of the flu season at the end of October, beginning of November, with a peak at the last week of December, beginning of January. So we're going to be giving a big push for the influenza vaccine, and to continue following those preventive measures for COVID-19, which are going to help us prevent rapid spread of the flu around our community as well. More than 90% of the cases that pass away due to COVID-19 complications have had underlying conditions, and continues to be the most common ones, high blood pressure and diabetes. Nevertheless, some other respiratory chronic conditions can also play a role, as well as renal and oncologic conditions also have been seen with the patients passing away. Our mortality rate and case fatality rate has stabilized and are plateauing, which is a good indication of the severity of the disease. And we continue to work very closely with the hospitals, in which they are still applying their infection control protocols, in which they're really strict in the way that they control all the visitors, and they're not allowing visitors yet to come into the hospitals, and how they're screening their employees for COVID-19. Next slide, please. We can see the daily positive cases with a rolling average by CDC week, in which CDC number 27 was when we were peaking in regards to the cases, and has slowly gone down by the weeks, as we can see on this slide. Next slide, please. On the 7-day rolling average per capita, we, as mentioned before, see that we peaked at 41.5%. It was going down, had a small peak again, and continues slowing down, and we're at about 11.9%. It is of important note that 2 weeks after we mandated the use of masks for all children greater than 2 years of age and above, we saw that we peaked, and now we started to go down. So that is very important to note, that masks do help, and that has proven scientifically to be one of the biggest tools that we have in public health to prevent the spread of the disease around communities. So thank you to the mayor and council for giving also that ordinance or the order to all the community. It was great to be able to order for children greater than 2, although the governor in his order mentioned that it was for children 10 and over, but we felt that it was important to get our children used to wear the mask, because they were also going to be starting to go to school, and at school it is going to be recommended to be wearing their face mask also. Next slide, please. As we can see, the effectivity rate, the doubling rate has continued to have an inverse relationship, in which the effectivity rate has gone down and the doubling rate has increased, which is a good sign. And on the forecasting on the positive cases, still, it is very broad how we can see the cases increase, but we all need to participate. We need community-wide participation in those preventive measures, which are very simple, and we have been repeating over and over, which is going to be wearing their mask, promote social distancing, and the hygiene, which is washing your hands often, not touching your face. And if you're sick, don't go to work. And most importantly, if your child is exhibiting some symptoms or getting sick, please do not send them to school whenever they start school back up again. Next slide, please. The average testing, even though the demand has gone down, we continue to see our positivity rate declining, but we need to continue advising everybody, especially if they've been exposed, especially if work in a high-risk category, to go get tested. We continue to be testing those groups that are considered high risk, which are the nursing facilities, assisted living facilities, and which they're testing residents and staff to keep them safe. We want to make sure that those patients that are positive are isolated or quarantined for those contacts that were close with a positive case of COVID-19. Next slide, please. Our cumulative cases and the hospitalizations by gender, we see how it has continued to decrease. And on this tornado graph on the left, we see that pediatric population has not been greatly affected, but we're expecting to see a sharp increase in positive cases of COVID-19 as the children return back to school. Very important to mention that the risk of contracting COVID-19 is not going to be completely eliminated in the schools, but the way that we need to decrease the risk of getting contracted is by teaching our children to, again, wear their masks, wash their hands often, and the teachers are going to be a wonderful job. The schools and the Department of Public Health are working together to promote a safe environment in the schools. All the schools have been improving their plans and have plans that are tailored to their community. They're the ones that know their student body, faculty, and staff the best way, and they've been doing their plans in such a way that are promoting the safe and well-being of all those that attend school. Next slide, please. On the hospital admissions, We see how over the week has decreased and is plateauing. Next slide, please. And on the deaths, we see that the doubling rate on the deaths has been increasing, which is a good sign, and the mortality rate and case fatality rate have plateaued, which is an indication of the severity of the disease in our community. Next slide, please. Next slide. The underlying conditions at the time of death, we see that it is about 6% of those people that have passed away from COVID-19 do not have any underlying condition, but the other ones show that high blood pressure, diabetes, and some other conditions are present at the time of death. Next slide, please. As we continue to see, and it's clear that the older we are, the more likely it is that we're gonna die from complications of COVID-19. And unfortunately, we're still seeing that men are affected greatly more than females here in El Paso. Next slide, please. On the cluster report, we see that the facilities that care for the elderly and correctional facilities have most of those cases and some deaths also related on the residents. But fortunately, we're going to see in the next slide that many of these cases have resolved and not always end up in hospitalization or death. But it is of note that most of the businesses are seeing positive cases of COVID-19. So not a single line of business is exempt from having cases of COVID-19 within their staff. So it is important to continue to promote those health practices or healthy practices by promoting the hand washing while at work. They all need to be wearing their face mask. As soon as people come to work, we need to do the health screening, asking if they're sick. If they are feeling sick, they cannot come to work and they can go back to work, go back home, and they can only come back to work when they're better, or if they test positive, until they are released from isolation. Next slide. As we can see, many of these residents and staff that have tested positive have resolved. And as we can see in most of the lines of businesses, we have done that. And with this, I believe this is my last slide, and I will hand it over to Ms. Dion Mack, which is going to explain in good detail how the task force have been working and all the recommendations that have been given and how we're accomplishing those recommendations. Ms. Mack.
Good morning. We want to just begin by reminding you that we did meet 2 weeks ago on the 17th. We had the COVID United Task Force come and present their final scorecard. The scorecard covers several short-term goals under data, communications, preparedness, and testing. Next slide, please. The items that you'll see moving forward are connected to the agenda items that are listed for tomorrow, 24.1 through 24.5. Next slide, please. Throughout the presentation, there are several other items that are covered that are short-term goals for the task force. They include supporting the testing strategy that Ms. Tracy Jerome will be reporting out on slide 45. So the task force goal is support testing strategy development for schools, T1. We'll also be talking about expanding our contract tracing, which is going to be on slide 79. In terms of communications and improving our reach throughout the community, you heard the city manager talk a bit about our communications efforts around testing in the introduction. The scorecard was a really important aspect of the work that we will be looking at as we move forward. As you may recall, it is one of our overarching goals. Next slide, please. For the task force. And what we were presented to you last week or 2 weeks ago was showing you how the metrics within the scorecard are tied to many of the short-term recommendations that we see within the report. So specifically, the scorecard is going to be covering many aspects of P3, which is performance reporting for the short-term goals. You'll also be covering D1, which is increased accessibility and quality of data. And also be touching on centralized and coordinating COVID-19 information and community health resources. With that, I hand it back over to Dr. O.
Thank you very much, Ms. Mack. And now we're going to have a presentation on how the dashboard is going to look. And it is with great pleasure that I introduce Chief Dennis Redd to give us a presentation on how this dashboard is going to work, how it's integrating the scorecard that is going to give the population and our community an idea how the COVID-19 is doing in our community. Chief Redd.
Good morning, Mayor and Council. I'm going to go ahead and go through this presentation. I need to share my screen so I can show you the dashboard. Okay, here we go. So in creating this dashboard, we wanted to provide as much data as we could to the public and to everyone seeking information. So we started off with the front page, which is more or less a summary page. As you can see on top, this is a collaboration we did with the EP County. We have positive tests with the new and cumulative cases, COVID deaths, new and cumulative, active cases recovered, and of course hospitalized and ICU, which are important things to track. We have the stage that relates to the scorecard that shows where we're at. We also use the colors as indicators, of course, yellow being 4 and red being 1, which is the worst case scenario for us. We also created tabs to identify the stages for each aspect of the scorecard itself. We have the infection rate, testing, investigations, healthcare readiness, and at-risk population. If you look down here, we have a breakdown of the cumulative cases showing positive recoveries and deaths. We have case disposition down here in the corner. We have a zip code map, and it's a color-coded map, so it provides some information. The nice thing about this dashboard, it's very interactive, so if you were to click on, say, 79928, and you want to look at the numbers, you can see how many cases are recovered, active. You can look at the gender. You can also look at race to determine how many, and you can also look at the breakdown by the age groups. And this works for each zip code, as you can see. We also have the map is also broken down by the city map itself, so the different cities within El Paso County. And same thing here, you can click the city itself, and it'll give you a breakdown. And of course on this side, when everything, this will show basically total for cases by race, gender, ethnicity, by city, or zip code, depending on which one you click on the map. And the cases by age group. The one thing we like about this dashboard, it also includes a scorecard. If you click this right here, the scorecard itself, it gives you a description of the scorecard and each aspect of it, defining the stages that we're in. Also, as stated, the infection rate, the testing, case and contact investigations, the healthcare readiness, and of course the at-risk populations. And then you can also click each tab so you can get down to the details of each aspect of the card. On the left side of the screen, you can see the scorecard metrics. And these are the metrics that we use to determine what stage we're in. We also added some visualizations into the dashboard itself. So we have doubling rate, number of new positive cases, infectivity rate, the asymptomatic cases, the doubling rate, and of course we put a little cluster graph in here as part of the investigation, or infection, to show where it's spread. Next is testing. And just the same, on the left-hand side, the metrics for the scorecard. And here's our testing data. and the positives per CDC week. Here we have the investigation tab. Same thing on the metrics. And the numbers up in the corner are the stage. Of course, 4 is currently the best, 1 is the worst. So we're doing very good in each metric here. We have a mortality rate, case fatality rate, infection source. And of course, you can see the mortality rate from the beginning of the infection or the pandemic all the way through. The next is healthcare readiness. These are the metrics that were identified in the scorecard, off on the left again. And just some more information to provide: percent of total hospitalizations that have COVID-19, current event, current hospitalization rate, hospitalizations with the 7-day rolling average, and the cumulative hospitalization rate since the beginning of the pandemic. We also put hospitalizations by age group and gender in the little tornado graph in the corner here on the side. And the last aspect of the card, it's pretty much just one metric discussing congregate facilities. But we also decided to put some other information in here dealing with underlying conditions. Also, cumulative cases, when we talked about congregate facilities, the cumulative cases and the deaths, along with healthcare facilities and detention facilities. And then here, COVID-19 cumulative deaths with underlying medical conditions, and that's at the time of death and overall. Going back to the home page, just simply click the home. And that concludes my presentation. I'll go ahead and
You should have
screen share.
right down there. This is a great.
Thank you very much, Chief Red, and it is a great example of the collaboration between expertise of many departments and it is envisioned and how departments within the city can work collaboratively, and that is the objective of the cross-functional teams, and how we can bring all that expertise together to give to the city and our constituents the best service possible. And I believe Ms. Mack will continue with her presentation.
So the next steps for the dashboard will be a presentation this afternoon to the County Commissioner's Office. And the next major item that you'll see as a report out regarding the scorecard and the work of the task force will be a patient navigation model. The team have been working on that for several months, and that touches on, again, major aspects and elements that enable us to be able to accomplish several goals in terms of scheduling, results, contact tracing. So I will pause for questions because this is such an important item for us to make sure we do that before we move on to data.
What questions does any council member have?
Mayor
Pro Tem.
You know, I'd wish we'd have more than 2 opportunities to bring this up, because again, having these presentations where it's back to back to back doesn't really, is challenging to actually get the questions out. But I'm curious about how this dashboard its practical use moving forward, if that can be explained, I guess in a layman's terms.
So I guess going back to the items that you have listed, sir, one of the overarching goals that we had for the task force was for our city to come up with a way to really be able to look at what stage and phase we're in as an organization. So this dashboard covers all that information, is updated live, so there's no delay in the information that's being provided. It also covers the accessibility and access of data that was a big issue and concerns moving forward. And so when you talk about the best practices and you talk about the things that the committee felt were really important in terms of us tracking to understand how we are and how we move forward, the dashboard includes those pieces. When you go to investigations, tab 4, some of the items that we have continued to have a conversation about has been about contact tracing and also our response time to ensure that we have that investigation captured. So it's also capturing that data in terms of performance KPI for that piece as well. In terms of whether this is the ideal dashboard for absolutely everyone that needs to look at that type of information, we made sure that the data that the people were accustomed to seeing are included in addition to the other key dashboard items. So I'm not quite sure if I answered your question, but it is my understanding that the committee and the city council very much wanted to implement the short-term recommendations that came from the committee. The committee specifically asked us to use one of two platforms. This is Power BI. This is the platform that was recommended.
Can you go back to the slide that shows the different stages again? The grading criteria for the different stages? I don't know if it was that far. Was it that far back?
It actually isn't in this presentation. Dennis, please share your screen.
It is on the scoreboard, sir, and actually to add even to what Ms. Mack was saying, this dashboard is going to give a lot of information that might be specific for institutions, for schools, for anybody who wants to use it for their planning and for different purposes, actually. And as a recommendation from the task force, and as you have mentioned before that you wanted to have a clear picture of what is happening with our city or with your zip codes or any specific area of interest, you will have it at the tip of your fingers when you get into the website. And instead of having something static, then you're going to have something that is going to be interactive. It's going to be something that is going to be as dynamic as the pandemic has been. And I'm extremely proud of the hard work that the people have put into developing this dashboard, that it's going to be ahead of many cities in the state and probably beyond the state lines as well.
Is there something else specifically you want us to come back for clarification on, Representative?
I guess
dashboard. The committee
I'm
has
trying.
looked at it. Go ahead, sir.
So I guess I'm just trying to look at it. So how many? We look at, like, for example, the cases and contact investigations. How many do we have total right now that we've reached out to? What is our total number?
So I guess that's one of the issues. That's one of the things that I think that this dashboard does really well. The dashboard tells us what we should be focusing our efforts and energy on and what they're trying to make sure that we're focusing on. If you can go to investigations for me, Dennis, is the speed at which we can get to people in terms of their status and continuing to follow them. So if you look at identified cases notified within 48 hours, you look at the positive test results notified within 24 hours, and you look at the percentage of cases lost. These are the metrics that our teams will be looking at in terms of ensuring that we're on track in terms of making sure that people know where they stand. The item that will be coming next week or in 2 weeks or next month is really going to be about the patient navigation model, which is the app that allows for us to strengthen some of these pieces. And when Tracy begins to talk about some of the testing, you'll begin to see the contracts that we're putting in place are ensuring that anyone that we're partnering with can meet the metrics of the test results that we need. And so it really is multifaceted in terms of all the elements that need to come together to make these test outcomes or make these outcomes positive for our community in the way that we want to in terms of the goals.
Does it list the percentage of cases that have been followed up, or what is the number of cases that we have followed up with so far?
So that was not in their dashboard in terms of what they saw as being one of the important metrics. What they felt was an important metric was making sure that people got notified. And we did hear throughout the community concerns about the speed at which people got notified. I think a few of you brought forward to us that there were people who said they never received notification. So our going out to work through the Lean Six Sigma process at the test site, we mapped that all the way through notification, looked at how long those processes were taking, looked at where we had good returns on those numbers, copying some of those best practices. And then as we're transitioning to the city leading the effort in terms of the number of tests that are moving, all of our community partners are committing to making sure that we can get those test numbers so that we can begin our contact tracing. What we heard in the past and what we reported to you was the delay in getting the information results in a delay in reaching the customer.
The Lean Six Sigma program was on the city-run test site or on the state test sites, private as well?
They went through every single solitary one, mapped it through every stage, did a pros and cons of what they saw, made some strong recommendations in terms of what worked really well. Really talked about we sent our Lean Six Sigma green belts out, they were tested. And so they were able to talk about every aspect of the work in addition to just sort of looking at how those test sites were run. And there are some things that we, as Mario said, are going to be low-hanging fruit in terms of the things that we'll be focusing on. That also becomes a really good information piece for us about what are our requirements when we talk about anybody who's going to partner with the city in terms of testing, the minimum requirements for what they must bring so that we can make sure that we have the best possible experience for our customer, making sure that it's not always relying on, going online to get the forms, really the detailed pieces that are going to be important for our customers.
Okay, so do we have a number of how many people have been reached out to by contact tracers at this point?
We are focusing on what's in the scoreboard. If council wants to continue to ask for other information, I'll do my best to make sure we're including that. But this is the scorecard as it was developed based on the recommendations of the COVID-19 task force.
I guess why I'm asking it is because it says that we're at a 4 on investigations. And a 4 on investigations would be that 90% of, according to the scorecard, 90% of our people would have been contacted, followed up with, if positive. So that number of 90% would lead to, I don't know, at least 15,000 people of 15,000 positive tests would have been followed up. And that's just being that's more like 74. I don't know the percentages there, but the larger issue is, I guess that's what I'm trying to understand is that we're basing it, I don't know if we can go back to that scorecard of stage 2, 3, and 4. We would
you can see it, sir. So look at that number where you are right now. You're not seeing us being at 94. That's a 7-day rolling average. Look at the beginning of that trend line. At the beginning of that trend line is showing us that we were at 29. So we had some days where that was not happening. And so we have to continue to monitor it and work to make sure that we are getting to the numbers that we've set within the goal and removing any barriers in terms of how we get there. So you're able to sort of see not just where we are right now, because this is going to be live data that's updated, that 7-day average continues to move. So as you're able to go online and take a look, if you see that number begin to drop, you're also going to see that number 4 drop because it's tied to those numbers that are in the scorecard.
So is that identified contact notified within 48 hours? Is that, I guess my confusion is that identified contact notified within 40 hours, just somebody is that just a positive notification within 48 hours? Or is that an investigation, a contract tracer reaching out to them within 48 hours?
So go ahead, Dr. O.
Well, basically, it's the same thing that you're saying, because the positive case that you have, once the positive case, they identify some contacts, then the metric that is above, once those contacts are identified, if it's 1, if it's 2, if they're contacted within the 48 hours, then you're going to be seeing reflected in this other area. The 100% of the positive test results that have been notified, they notify each and every one of those positive ones as soon as we receive that notification as well. So that is what you're going to be seeing. And as Ms. Mack was saying before, why we didn't have that much success in reaching those contacts within that specific amount of time, but it is of critical importance that we reach those contacts within that 48-hour mark, which is going to give us an advantage in how we're going to be able to identify those contacts, put them in quarantine, and control the spread of the disease, especially where we're expecting to see higher numbers as the winter season approaches, as I mentioned before. So you will be extremely delighted to play with this, try to understand it better, and we can answer all the other questions as you play with the scoreboard and the scorecard elements. And as you will be able to see, all these elements are going to be tied together. This is something extremely dynamic and extremely complex in a way that every single piece of the puzzle will interact, and there been it will be moving.
I just have one final question.
Mayor Pro Tem, you've had the floor for 10 minutes now. I'm not sure if someone else has a question.
I get lashed out and punished by my colleagues. What date does the start of these data start at? For example, the positive test results start off at 64%. Is that starting from March or from when? The beginning of the data. And I apologize to my colleagues for.
I don't know if you can see on the screen how you can put your cursor and you can see the date.
Okay, thank you. Thank you very much.
I want to compliment you all. This is excellent data. This is better data than I have received from my other colleagues across the state of the other 6 largest mayors. We share data, and I will share this with them on my next call. Excellent work. This is taking everything we print out on a daily basis and taking it to the 10th power or even higher. So I congratulate you all. This is great information, and I would just encourage council to work on it. And this is also echoing everyone's concerns about making sure we follow the task force and their recommendations, which this does. So I compliment the entire staff, Dion, and all your work with your team. Dr. Ocaranza, this is great data, and I believe this will provide great information for a lot of people. Thank you. Go ahead and continue.
Thank you. With that, I hand it over to David Coronado for data analysis.
Good morning, Mayor and Council. David Coronado with Bridges. So while IT is pulling that up the PowerPoint, I wanted to give you an update today on some of the new metrics that we've received from the state and federal agencies on the state of the economy and what's happening here in El Paso. But before I go into that, wanted to first give an update on bridges. So you've seen in the media and the news how CBP right now is changing the way that they process vehicles and pedestrians. They are being more strict as far as how they screen. They screen the crossers, they ask questions, purpose of the visit or the travel to Juarez and back to El Paso. If you recall right now, legal giving up on the restrictions to non-essential travel. And so as people are crossing back to El Paso, they are being asked, was this trip an essential purpose trip? And so they're being more strict, and that is driving wait times high, considerably high. We've heard from the media, even our employees that go to Juarez and return, 7-8 hour wait times to cross back to El Paso. And so that's having a huge impact on not only the region, right, and crossers, but also just the level of crossings that are happening right now at the bridges. So we have seen a decline in crossings from both northbound and southbound. And so that'll impact, our budget essentially. So wanted to give an update. When I keep tracking the numbers, we'll keep you posted on the impacts and the crossings in the next 2 weeks. We'll have more data to show you. Just wanted to give you sort of an introduction on that, what's happening right now. That started, I believe, about a week ago. That CBP has been doing this at the bridges. And so that is not only El Paso, but also across the entire U.S. Mexico border and in Canada as well. We've seen reports in Canada, similar impacts, people not being able to cross back and forth as easily. So anyway, so now we move into the data releases that we've seen over the last few weeks. Here on the screen right now, we have the unemployment rate and unemployment insurance claims. We have seen improvements in both of these metrics. You see that here, the unemployment rate back in February was about 3.8%. It went up in 2 months to 15%. And since April, it's been declining, slowly and steadily back to 8.7% in July. This is by far, a really, drastic, unusual behavior in the job market that we've seen. We haven't seen anything like this before. We're going to continue tracking these numbers. Just for some context, in Texas, the unemployment rate stood at about 8% in July, and in the U.S., 10.2%. So El Paso is right in between the U.S. and Texas as far as the unemployment rate goes. With unemployment insurance claims, we have seen a steady, behavior in the claims, about 1,100, 1,200 claims per week. That is still, considerably high from pre-COVID-19 levels. You see here on the graph going back to early March, went up to 8,500, and it's been declining since, again, holding steady about 1,300. And then if you go to the next slide. So with the business cycle index, this is a measure that the Dallas Fed puts out every month. It's a composite index. It looks at wages, employment, unemployment, and retail sales. So it's a pretty good indicator as far as how the economy is doing in the region as a whole. And again, sharp decline after COVID-19 hit, and then since April, May, and June, July, we've seen steady increases. Still below pre-COVID-19 levels, but again, really, really unusual behavior here, same as with the unemployment rate. If you look back at the Great Recession, we didn't see this kind of these movements and sharp movements and trends month to month. When it comes to the housing market, not only in El Paso, but other cities in Texas, really also unusual dynamics, to say the least. In the last 2 months, June and July, here on the screen, you see how year over year we've seen, large increases, about 30% increase in July in home sale volume after 2 months of decline, right? So it's not only pent-up demand for the last 2 months in March and April, where we see decreases in home sales, but also the mortgage rate is really low right now. So that's making it more incentivizing people to buy homes. And also the supply right now, we're running out of, there's been a shortage in homes and the supply market. So that's driving prices up as well. So again, really, interesting dynamics here that we're seeing in the economy and in the region. That's it for data updates. Like I said, in the next 2 weeks, we'll come back to you all with an update on crossings and how those dynamics at the ports of entry with CBP, how that's impacting travelers that go back and forth between our two cities. So with that, I'll pass it over to Cortines. Thank you.
Thanks, David. Can you go to the next slide, IT? So just a reminder on the strategy of what we've implemented when we came up with these list of programs, again, focusing not only on the short-term, but also on the long-term response. Again, the programs that we have utilizing this funding, the federal funding, is to address not only the community, but our economic response. And then finally, some of the programs are going to address not only our employee safety, but the customer safety as well as we start to get things back up and running. Next slide, please. So this portion of the presentation, I'm going to give you an update as far as where we are with expenditures to date. I also provide you an expected cash flow. So we've estimated out based on all the different programs and projects we have in place, what that timing looks like, again, just to ensure that we're going to stay within the current December 30th deadline. So our cross-functional team, our sub-cross-functional team related to the financial focus, working very closely with all of the departments involved with allocated expenditures. Next slide, please. So looking at the 3 buckets, again, the public health and safety, the community response and recovery, economic response and recovery, the total, again, the $119 million we received from the federal government. As of late last week, we've spent about $58 million between expenditures and encumbrances. That $58 million represents about 48% of our total allocation of that $119 million. So as I mentioned several times, I know our initial interim report was a little bit low as far as the expenditures, but again, that was due to the due diligence, the timing related to getting these programs up and moving to ensure we had them aligned and that we were going to address all of the critical areas. So as I mentioned, though, these expenditures are starting to move quickly. We got on the next slide, please. We've got it timed out as far as what we're expecting to spend over the next several months, again, with that December 30th deadline of what's in place currently in order to expend these federal funding related to the CARES funding. So again, our cross-functional team working very closely with these departments again to make sure that the timelines and deadlines that we have in place, that the programs and projects that are currently ongoing, that we're going to be able to meet that deadline and actually expend these funds by that time frame. Next slide, please. And then finally, the last slide will just show the breakdown of focusing on the emergency operations portion. Again, there's $69 million dedicated for that. And you can see what we have as far as expenses and encumbrances, over $15 million, and the remaining amount. Some of these items, again, are large items that are going to be coming before council here over the next several meetings. We've got one on the agenda for tomorrow. The additional will be coming forward in the future. But again, these programs and projects are moving forward pretty swiftly. So, I mean, as we've mentioned, we did all the due diligence up front in order to make sure that we had, one, the backup in place in order to be able to satisfy the requirements related to the reporting, but then two, make sure that we had all the programs and projects that were going to address the needs in the entire community. So that's my update for the financial focus. We can go to the next slide, please. With that, I'm going to turn it over to Tracy Jerome, who's going to talk about the testing recap and update.
Thank you, Robert. Good morning, Mayor and Council. Next slide, please. So we will continue discussing, as was introduced during the overview by the city manager, that we are continuing to remain committed to the expansion of our testing capacity. We will begin service at a new city site starting tomorrow, which will then give us an east side location, which is the current city site, and then we will have a west side location located at the Don Haskins Recreation Center. We have also, Department of Public Health and OEM have been working very closely as well, and have expanded their clinical testing and with the capabilities that are being offered across all 9 school districts. So again, we have maintained and expanded relationships with the school districts as we've been navigating the pandemic and meeting the needs at different times for those communities, those members of our community. So again, now with the plan returning to schools and with the new school year beginning, again, we are in a place now where we are providing their clinical testing support that's needed by all 9 school districts. Our average daily testing rate is down by 8.5% over our previous reporting period. This is a trend that we continue to see not only across the state, but across the nation. And we want to make sure that we do make it clear that our testing capacity is still expanding. We are not meeting our capacity at this point. There's plenty of capacity available. We need to make sure that people are still being tested. If you believe that you have come into contact with someone who has been exposed to or has tested positive for COVID-19, you should be tested. If you want clarification on your health status, you should be tested. Again, our asymptomatic rate continues to increase, which means that more and more people that are being tested are showing that they do not show symptoms, but they are shedding the virus and spreading. We need to make sure that we continue the trends that we are on right now. We are in a better place than we have been, and we want to continue to improve the health status of our community. And testing is one of the steps that needs to be taken, along with social distancing, wearing the mask, practicing proper hand hygiene, and being tested. Our cluster management team continues to really focus on the most vulnerable populations in our community, which are our nursing homes, our assisted care living, and our long-term care facilities. And they spend their time each week providing testing. In addition to the testing numbers that you see publicly across our testing sites, they're providing testing again at all of those locations as well. Next slide, please. So again, in addition to our new city site and our expanded and evolving work with our school districts, as was mentioned in the introduction, we have also created a new collaboration with We Medical Labs. Their services will begin today and are available. If you go to our website, epstrong.org, you'll be able to get all the information about booking your appointments. What's exciting about the new collaboration with We Medical Labs is that it's a different type of testing opportunity for the community. In addition to offering a walkthrough testing location, which is on Murchison Drive, The We Labs will also offer at place of employment appointments, which means that if you want to be tested or you want to have a group of individuals tested at your location at work, you can book that through We Labs. In addition, We Labs is also going to be offering a home lab program. And this is where trained medical staff, their trained lab staff will come and collect, will test you and collect your test specimen at your home. Again, all of these services are by appointment, and all the appointment booking information is available on our website. But these appointments are available Monday through Friday, and these services begin availability starting today. And again, this is really important because, again, this is another expansion of ways in which our community can be tested. So there's no excuse. And if there's any issue with getting out, either getting off from work or getting out of your home for whatever challenges or vulnerabilities you may be facing, we are now offering another opportunity to be tested, which is very exciting. In addition, we have also contracted, as was mentioned by Chief D'Agostino, with 2 additional labs, AIT and CPL. These labs are not for testing, these labs are for processing or testing. So again, this is to make sure that we are constantly improving and really delivering on making sure that not only can people be tested, but that they get their results in a timely fashion. Next slide, please. This is a quick recap of, again, our ever-growing number of collaborations. There was also a mention earlier about the UTEP testing. I'm happy to confirm that since they started their testing capabilities, they've tested approximately 2,500 members of their community, which are members of our community. So again, more and more testing data being made available and testing opportunities so that everyone can understand and know what their status is so that they can stay safe and stay healthy and protect others in the community as well. Next slide, please. This is, again, a quick recap of all of our different testing sites. We will be adding the city test site, the second site. It'll be available starting tomorrow. So the next time I update you, we will have 2 city drive-through sites available. But again, the list is pretty diverse when you have a look and see where we are and how we're servicing the community. I'm also happy to confirm that the state has extended their commitment to us for the mobile testing and the rural testing that they've been providing. The support has now been extended through at least the 15th of September. Again, this is a result of continuous advocacy through the mayor's office. Thank you, Mayor Margot, for that, to ensure that the state continues to support us with our testing sites. Again, those testing sites, we have 2 mega sites that are set up, which is at we have at the SAC, and then we also have at the EPCC. So these are available drive-through, and then we have our hybrid walk-up site at Nations Tobin at the Rec Center. In addition, the rural testing schedule has been now confirmed for the next coming weeks. And again, for all those details, please visit epstrong.org. But in the coming days, we'll be in for testing Socorro and Fabens, Horizon City, out in Montana Vista again, Anthony, and also in Clint. So again, for those specific locations, please check the website. But again, this is so important that we go out into the community as deep and as far as we can to make sure that everyone has these options and these opportunities. We want to make sure that we're guaranteeing equity and access to all of our testing. Next slide, please. And this is a quick recap of some of the great collateral that's being presented and being produced by our PIO. The Public Information Office works diligently to make sure that we are reaching in various and sundry ways all across the community in whatever way that we might be able to reach people through television. Bilingual outreach is very important to us. Through print media, working across Pandora again for radio. Making sure that we're reaching all different age groups and really making sure that we are communicating the message of going, getting tested, and taking care of yourself and others. And I believe that PIO is going to show the video here. Is that correct? We can click on that.
Victoria, I'm so excited I finally get to go back to school. Well, not just yet. The city officials have said it's still not safe to go back to the classroom just yet. So for now, we're starting school virtually. It's a great idea for parents to set up a quiet learning space for their kids. This way they can concentrate and be ready for class. And even though we're learning from home, we have to do good on our schoolwork and listen to our teachers. We also need to keep our school supplies, computers, and iPads clean. Wipe down your keyboards and anything that you touch when you're done for the day. Wash your hands, and remember, let's do our part to keep each other safe. Have a great school year. See you next time.
And we thank our youth ambassador, Victoria. She's really terrific at communicating with her peer group. And with that, I will turn it over to our next section of the presentation. Thank you.
Hi, this is Ellen Smythe, Managing Director, Sun Metro Environmental Services. This section goes over the education, communication, and compliance. Next slide. It's connected to item 5 on the agenda that was posted by Representative Rivera requesting a presentation and update regarding bars as approved for a restaurant license, and to go over what we've been doing with the enforcement efforts and reporting on that particular subsection of the entire compliance issue. Next slide. This slide is just to give you a snapshot of all the various orders that have been passed in the last 3 months. So you can see there's been a whole bucket full of orders that have been implemented and then rescinded, and implemented and extended, and implemented and modified. So I was just trying to demonstrate how much time and energy it requires to keep the officers up to par on what the current regulations are. And I know that the legal team touched on those earlier, and tomorrow you'll be voting on additional extensions. Next slide. So the following slides are kind of a walkthrough on a bar to conversion restaurant process. Next slide. So the Texas Alcohol and Beverage Commission, they've issued a Rule 33.5, and it, of course, has already been amended as well. But it essentially, it was intended to make it easier for bars to be able to keep having their clientele and keep the cash flow. What happened, though, is that the bars were allowed to open for just a very short window of time, and then they were closed again. And so now it's really the restaurants that are able to stay open with the 50% capacity. Next slide. So the way that the TABC determines whether you're a bar or restaurant is based on your sales. So every establishment has to turn in to the TABC their sales and classify it whether it came from alcohol or if it came from food. And if most of your sales is from alcohol, you're a bar, and if most of your sales are from food, you're a restaurant. Next slide. So at first, they required that every bar that converted to a restaurant had to have a certified kitchen, a commercial grade kitchen. And so there were many who could not possibly do that. It was just too expensive. It would take too much time to design it, hire a contractor. And so eventually they backed off to where on the next slide, you'll see that they've changed the rule to where now they do not have to have a commercial grade kitchen so that they can continue having their clientele come through. Next slide. So this is how it works. You apply to the TABC, and you can find this paperwork online. After the review by the staff, the TABC either reviews it or they either approve it or deny it. And then the approved applications receive a notification officially in the mail, and they receive a new revised license. Once it's approved, the applicant is required to show the proof to the city, and then it is the applicant's responsibility to notify us. We do not go looking for this change of license. And then we provide the proof to the city of the state license change. And so the city assesses the appropriate fees through the one-stop shop, and the inspectors can go out and make sure that everything's according to the city code. Next slide. So in summary, the TABC governs this. The city does not govern it. Our only involvement is to reissue the city license and collect the fees. Next slide. So over the last few months, you had been requesting data on how many enforcement efforts have been taken by the city staff. And you can see the list of the establishments on this slide. And the length of the suspension that was issued, either 30, 60, or 45 days suspension, and what area of town that the police headquarters actually issued the suspension. Next slide. In terms of the fire marshal's office, they, as you see on this slide, you can see all of the numbers of visits, warnings, citations, follow-ups, whether it's at businesses, residents. So there's thousands and thousands, almost 9,000 visits that are being conducted by the city staff. And you can also see the codes. The codes were issued by the municipal clerk for the courts. The city attorney has approved that these codes be used by the officers when they write a citation, and the codes are tied directly to the violation. So you can see the different violations also listed on the slide. It could be operating as a bar, and they're not, operating as a restaurant, and they're not, social distancing, the prohibited gathering, and the lack of the required disinfecting and cleaning requirements. Next slide. So you can see on the police that they've been very busy responding to calls. These calls are coming in majority through 311, but also through PD non-emergency. And they've responded to approximately almost 500 calls with the health department. So the way it works is the police department teams up with members of the health department, and they go during the day to businesses who primarily work from 8 to 5. They'll hit those. And then the night shift, they primarily focus on the restaurant and bars as well. We're kind of limited right now on the number of vehicles for these compliance groups. We've ordered new vehicles that are being delivered this week, next week, and they're unmarked vehicles for the police department, so that they can blend in with the rest of the population. But because of the COVID-19, each one of the officers on patrol have been assigned individually, where many of them used to team up on these task force. But because of the distancing requirements for our own staff, we're assigning individual vehicles to individual officers. And so with the addition of the additional vehicles, it's going to make this effort even more widespread, both during the days and during the nights. Next slide. Again, you can see how many hours that this task force is logging. All of these payroll is being funded through the CARES grant. We'll continue to put as much effort as possible and until as long as it's needed. And, you know, we're very thankful to have the CARES funding to cover this additional services we're providing for the city. Next slide. And that's it for that section, unless you have any questions.
Representative Rivera has a question for you.
Yes, sir.
Thank you, Mayor. Thank you, Ms. Smythe. That was a great presentation. But just to let my colleagues know it, and and thank you, staff. That's why I had placed this item on the agenda because as you can see in the closed backup for item 5, which is what you already covered, there was great concern by the residents on how the bars were conducting themselves and operating under the state rules. So I thank you for explaining the 33.5 and the task force actions, but you know, it's a way to assure that our citizens understand that it's not, these aren't coming from the city. Now I want to make it clear that TABC has relaxed those policies to make it easier for bars to open and not the city, correct?
That's correct.
And that's what I want to make clear for the citizens to understand, that it wasn't the city of El Paso who lacks these rules, but I understand also that from prominent restaurant representatives that they merely want the city to have their surprise enforcements on what is required to prevent this COVID-19, which is social distancing and everything else that is required from the city of El Paso. So I thank you for your presentation, and you will be working in collaboration with TABC, correct?
You know, really, we don't spend much time with them at all because whether or not they issue and approve the new request to change over is done as administratively, you know, it's paperwork. But once they receive the paperwork, then the establishment makes contact with the one-stop shop. So really, our contact is still with the establishments.
Okay, and it'll be predominantly enforcing the social distancing, the requirements that are set forth by the city. And
yes,
okay.
Correct.
Again, I thank you very much. And I forgot some, and one of my other colleagues has something to ask, because this is important. This is not only affecting District 7, it's affecting other areas of our community. And I know they get calls as well as I do regarding bars violating the rules that are in place. Thank you. Thank you, Mayor.
I want to add that also TABC has their own enforcements, and when we report it to them, they have agreed to expedite reviews and send staff out there that we don't have to send to verify. Representative Lizarga has a question.
Yes, thank you, Mayor. Thank you, Alan, for the presentation. On page 56, you were saying how the bar or the restaurant has to issue a revised license. Can you tell me how much is the revised license cost them?
I don't know that. I don't know the answer to that. I could get back to you and let you know.
Okay, thank you.
I believe that's about a $776 cost.
That's correct.
$776?
Yes, ma'am.
Okay, and then Alan, one more last question. You said you're purchasing new vehicles. I'm sorry if I missed it. How many new vehicles?
13.
13. Okay, thank you very much.
You're welcome.
Representative Anello has a question.
Yeah, and I don't know if it's a question as much as a statement. You know, unfortunately, TABC is giving out new permits and licenses to people that do not serve the 51% over food, right? So recently, my office tried to protest a bar in 5 Points, and we're told by TABC that we didn't have the authority to do that, and they were being given the license. And so I'm a little concerned, and I don't know if we have any information on if the governor is going to start allowing not restaurants but bars to reopen, because I don't understand why these licenses are being given right now. I also still have concerns. I've made several complaints. I know several of my constituents have made complaints about bars or restaurants, bars that are now operating as restaurants under the new guidelines that are clearly not obeying the social distance ordinance, right? And again, if we're doing the contact tracing, we would know that have had several individuals who have tested positive for COVID have visited those bars before testing positive and right immediately after testing positive. So I guess my questions are, do we know if the governor is going to lift the orders and bars are going to be able to open, and how we're attaching enforcement to A, constituent complaints, and B, tracking information from positive COVID cases. Yeah, I'll let you answer this first, and then I have another question.
Well, on whether or not the governor is going to change his mind, I would have to defer to the mayor. I think he talks to him, I'd say more often than I do, but I've never talked to him. So, but I'll defer to the mayor on that one. And of course, we are tracking, the health department goes out with the police officers, and one of the top priorities are the addresses that the health department brings with them, of course, from their testing and their research on interviewing the people who have tested positive. And so that is kind of where they start their shift. Of course, they do hit 40 or 50 businesses every day. So I think we're doing the best that we can with the information that we have. If the offenders or the positive people don't want to tell us the truth, then that's a whole nother problem that we've run into.
I'm not.
I still have another question. I always while my mailman is here. I apologize. Ellen, I guess what my concern is we're seeing a lot of complaints, and I don't see these restaurants making any amendments.
Yeah, I guess just keep reporting the complaints either through the 311 or the PD non-emergency, so that they are just continuous. We have hotspots, you know, the calls very, very often will start to show the trends of where the hotspots are. And if you keep calling it in, then that suddenly will show up as a data point as one of the hotspots if we're getting several calls. So really the best way is to follow the process and let the process work.
Ellen, we do have members of the mitigation task force online who can speak to the relationship with TABC.
Great, that'd be great.
All right, yeah, go ahead.
Commander?
Yes, Mayor, Council, good morning. I'm Commander Talamantes, and we oversee the efforts for the mitigation team and collaboration that all the stakeholders and city and state agencies that are going to be enforcing and educating the public and businesses on this. Just to let you know, as far as the restaurants, the bars that are now converting into restaurants, they have to sell, more of their sales have to be more than 51%. But of course, a lot of this, trying to do the right thing as business owners, are trying to somehow survive this impact that COVID's having in their businesses. But you will have those that are going to be, we're seeing that a lot of them are, of course, pushing the envelope, having more people than what they should, not taking all the health, the requirements of the health guidelines provided to them by health departments. So we are seeing those business owners that are not doing the right thing. And those are the ones that we're focusing on, making sure that not only do they have the most current and accurate information on what their requirements are, and so they have no excuse when they get cited or given a fine, that they have no excuse. They were given ample education, training, and resources, so they know what they need to do to provide a safe environment for their customers. So the health department, the code, El Paso Police mitigation team, and TABC, we are all now on the same page as far as a database that we have for all those businesses. This will avoid duplication of efforts, redundancy, misinformation. So we're providing the same accurate information about the health orders, but also we immediately address those. Now, I'll tell you, although TABC is giving this licenses for the governors allowing this, they are being very proactive and responsive to our complaints. Whenever we go directly to the person in charge here at TABC, and immediately the following day they follow up. So far, they've suspended 7 licenses of those clubs, restaurants, and this is in the very just recent time frame. So this collaboration that we get calls, complaints from 311, from 911, and also referrals from the community, from the hotline, the EP Strong, we are now on the same page and we're immediately responding and addressing these. I think moving forward, we have a lot of work and a lot of challenges, but we're going to maximize our resources by working together.
Great. Commander Talamantes, it's good to hear from you. I hope you're well. Thank you. That does make me feel a lot better. And it actually transitions into what my next question is, if you don't mind staying on the line. And so for this new ordinance exception we're going to do to allow businesses to kind of use the right of way, and I should say, I think it's great. And I also totally understand why a lot of bars are kind of adapting to restaurants now to survive. I completely understand that. And I don't want to come off as the fact that I'm not supportive of these businesses. But I think the conversation we had a few weeks ago about there are bad actors and there are a lot of community members worried about a few bad actors. And so I really kind of want to focus on, who we're allowing to have these street permits, and the idea that if there's a citation or a complaint, they will not be allowed the exemption to be able to use the right of way to expand. Is that correct?
Yes. Well, there's, for example, I can tell you, Representative Mello, that one of those few bad actors that we're seeing is a bar that they're getting clever, and now they're trying to close the doors, lock their doors, and have open their bid. Right, so TABC is gonna go immediately today and address that because they had already suspended this bar. So you're gonna have those people that are just defiant and are gonna push the issue. But that's when we're in a phase now that we've already educated and provided guidance and health orders to most of the businesses throughout the city. We've been doing this as a beginning. So now the phase of enforcement is gonna be very important because there's no excuses for people not to know. And you're going to have this very defiant establishments that we are going to join resources and go ahead and shut them down.
Good. Well, I'm glad to hear that. Thank you so much, Mr. Talamantes. It's always good to talk to you. And thank you you definitely made me feel better. And I definitely feel like I can talk to my constituents now with more confidence in this. So thank you for your work on it as well.
Thank you, Ms. Anel.
To answer Representative Vanello's question related to the governor and opening more, I've not heard anything that would indicate that he's doing that. It can change. Does anyone else want to speak? Representative Rivera has another question. Does anyone else want to speak before questions? Okay, Representative Rivera. Thank you,
Mayor. Commander Talamantes, you brought up an issue that's a repeated complaint that I received in my office, and I don't know if you can answer this again, or if I missed it. The repeated complaint is from residents that when the COVID-19 compliance task force gets a call lodging the complaint, that it doesn't get addressed immediately, often or even on the same day. What is the process to lodge the concern and receive a timely response?
Yes.
I'm sorry.
Yes, sir. That's a very great point. So right now, the calls for service, if they need immediate attention, a complaint that an officer needs to respond right away, they call a patrol. Patrol officers respond and address that. The ones that come in that don't necessarily need an immediate response are referred to 311 or non-emergency, and those are followed up the next day. But the ones that are immediate, officers respond. They make a report, their observations, they get compliance, obviously, and then we forward that to TABC. This mitigation team that I from the police department that I mentioned, we started this 3 weeks ago, and the first phase was to ensure that the messages of the health orders were accurate, because a lot of businesses, and there was confusion, even our own site had some inconsistencies, so we got to make sure that everybody's on the same page. It's only the fair thing to do, right? And now that we're together, we have the vehicles that we purchased for officers because we were riding together with health department, and now that we have those vehicles, we're going to be able to expand the mitigation team working not only for during the daytime, but also having them work at nighttime where those clubs and bars complaints are going to come in and where patrol, they weren't really available because they were obviously handling crimes, call for service, other priority calls, right? So now you're going to see more of a effective, efficient response if we put those second shift of officers working at nighttime.
Okay, and I remember, and every unit goes out during that time. They are briefed before they go out, right? So every officer really is aware of the ordinance that or the task force rules and what they look for, what to look for specifically.
Yes, sir. Our academy has put out training bulletins, and also our supervisory staff has trained officers on what they can, the most common violations are going to come in. That's max occupancy, social distancing, not wearing masks at businesses, and those type of establishments. So we have put, but the mitigation team, of course, is going to have more of a working insight and working with every single health order that's out there.
And so do you work in collaboration with TABC when you go out there as PD?
We haven't gone out there with them as a team, but like I said, we do have constant communication with them. We sent the report to the person who's in charge of the local TABC here, and that person assigns TABC to immediately look into it the following day.
Okay. Thank you, Commander. Thank you for the information. Thank you, Mayor.
Thank you. Let's go to number 6. Jessica?
I'm sorry, Mayor. I think I had signed up to speak on behalf of the citizens of El Paso. This is Yvette Renteria. Henry Rivera is...
Check with Laura. Let me check. Laura, do you have somebody signed up, Laura?
I did not have anybody signed up for this item.
Okay, well, go ahead.
Okay, so I had spoken with Henry Rivera. I also deal with COVID-19. I live across the street from the bars Única Manera. I had contacted PD, and let me state this too. I contacted TABC because I could see patrons going into the bar. My office faces in that direction. There was many clients going in that were not social distancing and not wearing facial masks. I do know that alcohol inhibits our inhibitions. And my thing is that some of these bars too, they're stating that they're selling food items when there is no food being sold at all. So my concern is if these bars are giving these licenses, how do we know that they're actually selling food? And how do we regulate when it's so late at night that individuals are following social distancing, not only wearing masks? Because we do know that alcohol inhibits our inhibitions. So how are we to monitor that?
Someone want to respond? Ellen, you want to respond?
Well, again, like I said, when an establishment applies to change from the bar to a restaurant status, the paperwork is between the establishment and the TABC. Once the answer is yes, if the answer is no, the city doesn't see any paperwork or any involvement. But if the answer is yes, then the establishment, it's on them to come to the one-stop shop and turn over their new paperwork so that they can pay the appropriate fees, and it can go into our database, and so we can start an inspection at that time. Other than if it's just a straight bar and they're continuing to be a bar, at this point they shouldn't be open at all. And so it would fall into the compliance task force. The health department and the police officers that you just heard about are going out in teams, and so the best way to address it, again, would be to call the 311 or the PD non-emergency and report it so that it gets into the queue.
I have one more question. So when all this was occurring, I had contacted the non-emergency line many times over a period of 3 weeks. nothing was being addressed. Every time I would call in, I know there's other priority calls, but basically a couple of times they actually laughed at me. So, and I'm trying to do my rightful duty as a citizen. So we also know, because I do deal with the COVID-19. I'm an epidemiology nurse. Let me just state that. We know that this disease attacks our elderly. It doesn't discriminate. Let me just say this across the board. So these people are going out and drinking, coming home, don't realize this, have been intoxicated, maybe, and they're infecting several people around them. I was trying to do my due diligence and contact this city because they were also playing extremely loud music. I mean, there were several violations across the board. My concerns were being pushed to the wayside. What do you suggest? How do we handle that?
Ma'am, if I can, this is Commander Talamantes, and if I can respond, and so you're absolutely right. I mean, there's a lot of businesses that are gonna start pushing the envelope and start making defying the orders, right? And even though they've been provided with information, the guidelines of what they need to follow. So I do believe that now that we're coordinating, making sure that we don't have different system databases documenting complaints, that now we're all on the same page. And that's why we have a system now that any complaint that comes in, it doesn't go to a different health department or code or police department. Every complaint is not going to be seen and shared by all these different stakeholders that are going to be educating and enforcing. So if this fell through the cracks, I apologize for that. I guarantee you that we are going to look into this business and we are going to follow that immediately. But we shouldn't have anything falling through the cracks anymore going forward.
And Commander, this is Dion. I just wanted to make sure that the constituent know that particularly in this case that we were talking about over the last week or so, we had detectives be our first point of contact. So you may not actually see, a marked vehicle show up. So there may be, we may be addressing it, you may not see a marked vehicle. So I just want to make sure that people may not see the expected arrival of our patrol cars to some of these issues.
Absolutely. Thank you, Ms. Mack. And that is a true, very great point that a lot of officers do respond, and if they don't see they don't see a violation, or if they do see a violation, they might give that person a warning. They might advise that person. So it's depending on the violation and how aggravated it is, the officer can have that discretion to issue a warning, to issue a citation. So I will definitely look into this business and see what we've done so far. But any call that we receive through 311 or the non-emergency should be handled, it should be addressed, even if it's that night or the following day. So it depends on the officer what he observed that day, but it could have been handled. Absolutely right.
Excuse me, and one more thing. Can we alert the citizens of El Paso how to follow through with the call? Because I had to go through many channels just to make a complaint. Not only did I call 211, I had to call TABC and the fire department, but I already knew that procedure.
Ms. Renteria, I'm sorry, ma'am. You've reached your time limit to speak.
Thank you.
Thank you.
Thank you, everyone.
And this is Dion. I will follow up to make sure we're pushing out a little more on the compliance pieces in the process for that.
And also, to answer her question, 311 is really your absolute best bet, because they will route all those calls to the proper individual who can get to it as soon as they possibly can.
Okay, let's proceed with number 6. Jessica.
Yes, Mayor and Council, Jessica Herrera with Economic Development. With me today is Miranda Diaz. She's going to be providing an overview. Miranda has been taking the lead in working with a number of these programs that we're going to be putting a spotlight today for you all. And with that, I'll have Miranda jump in. Thank you.
Good morning, Mayor and Council. I'm Miranda Diaz with Economic and International Development. What you're seeing on your screen right now is an overview of all the grants that we have now executed using the CARES dollars. Next slide, please. This is a screenshot of our Business Resource Clearinghouse. Right now, they're highlighting the 3 small business grants that are open for application that any small business in the city limits of El Paso can apply for. It does show the 3 organizations that are subrecipients, which are People Fund, Project Vida, and Lift Fund. The website is epbusinessstrong.org. And this is going to be a website that we're going to be directing all small businesses in the city to continue to check, because it will be updated as any new information comes out. As of right now, it will highlight these 3 programs because these are the main focus to get these dollars out to the small businesses. And mid-September, it should be updated with more information of the other partner organizations who are offering various services to the small businesses in the community. Next slide, please. I did forget to mention on the grants that are displayed on the other slide, those grants are not going to be given out on a first-come, first-served basis. They're going to be given out on a lottery basis once the application period is closed, which is on September 15th. So on this slide, it's the 3 programs that I'm going to be spotlighting. First is the Business Resource Clearinghouse, which you all just saw. This is the digitalized, centralized information source. So again, we're asking all businesses to please go to epbusinessstrong.org. This website was made to complement the city's EP Strong website. It's going to be mainly for businesses, so that way they're not having to waste time by going to multiple websites to try to get information. It's going to contain local, state, and federal information that is useful or needed for these small businesses to continue operations and to help operations. Then we have the Small Street Business Street Assistance, which is with El Paso Hispanic Chamber. They're going to be handing out business safety kits and counseling for small local businesses. As you'll see below, it shows a picture of what is included in the business safety kits. There's only going to be about 500, but of course, this is for those businesses that truly need it. There are a lot of businesses that already have this type of PPE, these types of stickers on the floor that say to social distance, and there's a lot of businesses that can't afford the professional ones. So these will be for first come, first serve, but of course, if the businesses already have this, they'll be passing them up to the businesses that need them more so. They're also going to be holding trainings, and they've already held 2 trainings in English and in Spanish, and they've had over 290 participants. And then we have our Buy El Paso marketing campaign. This is with the Better Business Bureau, and this program is encouraging everyone to shop local, and it highlights the businesses that have taken the pledge with El Paso, and the pledge is again to make sure that the business is operating safely both for their employees and for their customers, so they know when visiting or working at these businesses they will be safe. As of right now, we've had 207 businesses sign up for the pledge, and of course this is also a prerequisite of being featured on the Buy El Paso campaign. And again, the branding complements the city's EP Strong website. Next slide, please. And this is the Buy El Paso. The tagline is, when you buy El Paso, you heart El Paso. And what it is since the local businesses are taking care of us, again, by taking the pledge to safety and making sure they're taking those additional measures to make sure everyone is safe, we want to take care of these businesses. We want to make sure that we're there for them and they know that we appreciate them taking care of their employees and their customers. So to visit this, you can go on to buyep.org. That website should be up later on in the week, but we just wanted to give you guys a preview because we are so excited about this program. Next slide, please. And these are the GIFs that will be out on social media. So I even told the team that I don't post a lot on social media and I don't have a huge following, but I plan to post more so that way I can use these GIFs and highlight a lot of the local businesses that I love to frequent myself. Next slide, please. This shows the banners that they will have up throughout the city wherever we're able to place those banners. And again, this is the GIF for the Buy El Paso. Next slide, please. This shows the social media on the left, and on the right is a program that I'm real excited that's part of the Buy El Paso. What they're doing is they're getting with local artists to make some sort of, I mean, logo or a design that captures the spirit of El Paso. And these t-shirts are going to mimic the ones that we have for the streetcars. They're going to have the soft feel of the t-shirt, and they're limited edition. So what they're going to be doing is various businesses that have taken the pledge, they'll be having these t-shirts at those businesses and say, hey, for a limited time, if you go buy something or you purchase a service, you could get one of these t-shirts for free. And the designs are amazing. I'm excited myself to be able to know which designs are going to be at which stores, so that way I can frequent those stores and pick me up one of these shirts. Next slide, please. And then this is a video we wanted to share with you all. There will be a Facebook Live kickoff to this, and we will let you know as soon as we have a final date and time. That way you all can watch it. Next slide, please. Okay, and so like I said earlier, we have executed all these agreements, but that doesn't mean that our job is done. We are continually working with all the subrecipients to see how the projects are going, how the funds are being expensed. Of course, if there's any hiccups or anywhere where we see that the dollars can be better utilized, we will jump in and make some suggestions as to how they can be better utilized for the community. Recently, we had asked for $523,000 for the LIFT fund for small businesses that were in the queue from the initial grant program. They weren't all expensed, so we have some recommendations that will be presented after this by Mr. Alex Hoffman and Mr. Ben Fife as to what we would like to do with some of those dollars. And so now I will go ahead and pass it over to Mr. Alex Hoffman. Thank you.
Good morning, Mayor and Council. Alex Huffman with Capital Improvement. One of the other items that we wanted to present as part of this program is called Sun City Safe. This is an emergency ordinance will also be considered in support of this, essentially suspending a number of the rules that are in place that prohibit businesses from occupying public right-of-way, as well as repurposing their private property. As part of this program, there's three sub-components to it. One is called Sun City Safe Streets, which is the top. This is really looking at repurposing city streets. The support for this is just because of the substantial reduction in the number of vehicular trips we've seen throughout the city. And so there's a real opportunity to repurpose the streets for more valuable use. And so this would allow for people in front of their businesses to utilize public right-of-way, assuming that they meet eligibility criteria that would be looking at making sure that the program would be deployed in a safe manner. The second component to this is Sun City Safe Business. And so under this program umbrella, this would be utilizing off-street parking that's on individual property owners' private property. And this would be repurposing the abundant off-street parking that many of these businesses have and allowing for additional space for outdoor retail or for dining or for queuing into the business. And so in order to facilitate this, we'd be looking at reducing the off-street parking requirements required under our zoning ordinance to allow for that to take place. And then the final scenario is Sun City Safe Food Court. And so this is really looking to expand opportunities with the program or the project that the DMD already put in place and allowing for businesses to take advantage of this. Next slide, please. And so in order to demonstrate these projects, the city's proposing to do 2 pilot projects. And so that way they can serve as examples for private business owners to replicate. The first project that we're looking at is the Right-of-Way Cafe is what it's called. And this would be taking place on Stanton Street in between Mills and Texas. And so with this, we'd be looking at barricading a portion of the streets and setting up tables and chairs that we've been able to collaborate with MCAD to acquire and to utilize the space for outdoor dining. Next slide, please. And then the other project that we're looking at debuting is the pedestrian way, which would be on Campbell Street between 3rd and 6th. And so this would also be utilizing barricades, but this would be really looking at promoting outdoor recreation to help address some of the underlying health issues. And so we know that, throughout the city, many of our sidewalks that we do have are, usually only about 5 feet. And so by expanding the right-of-way to allow for safe passage, people can observe the social distancing guidelines of 6 feet, while also promoting outdoor recreation. Next slide, please. And so the general idea behind the pilot program is that we'd be working with a number of our user departments. We've already identified eligible streets where the occupation of right-of-ways can take place, and then making it eligible to all private property owners to utilize their own off-street parking to do this as well. There would be no cost to applicants to utilize this program. There would be a cost that we potentially have a way to help offset through CARES dollars, but looking at allowing for people to do this at no cost to the application, but they would have to secure the traffic control equipment. Also making sure that applicants are coordinating cleanup and then also meeting rules that we would have in place as part of this program to maintain social distancing and CDC guidelines. And just to be clear that this would be utilized during the time of the emergency order, and at the conclusion of the emergency order, the program would cease unless council were to extend its life. Next slide, please. And so with that, I'll turn it over to Ben Fife, who's going to discuss another program.
Good morning, Mayor and Council. Ben Fife here to just let you know that we will be rolling some of the CARES funds into our operating support program. This is a program that has been in effect for 15 years now and provides operating support to our largest nonprofit arts and cultural organizations. It's designed to support the organizational stability of our arts and culture assets, as well as cultivate organizational growth and professional development. All of these organizations are professional. This funding will help support approximately 60 jobs and allow them to be able to recoup some of their losses from closures that have affected their revenue. Next slide. So due to the closures and restrictions that have been mandated by the governor and also our local emergency order, a lot of our organizations had to cease their season of events, which included performances in theaters, exhibitions, as well as outreach that happens in schools and neighborhood spaces. So we are excited about this particular funding source to be able to help offset some of those losses. These organizations, as I mentioned, support about 60 professional jobs within their ranks, but they also help support the work of about 1,600 artists annually. So again, this is going to be a really great opportunity to be able to help our cultural sector. And with that, I will open it up to any questions. If not, turn it over to Carrie Weston.
Let's go to number 7.
Morning, Mayor and Council. Carrie Weston, I'll update you on personnel actions and our continued work on facility preparation. So here's the status of current hiring actions. Dion mentioned earlier, we are projected to hire an additional 150 contact tracers by the 3rd week of September. And then a lot of the other positions you see on this chart all are to enhance our overall test support. Next chart. So we've made a lot of progress in terms of our back to work preparations in our city facilities. Now we're focused on our recreation centers, libraries, and municipal court facilities. Next slide, please. And we're continuing a rotational schedule on deep cleaning and fogging city buildings. We actually received some additional equipment, so now we've got the flexibility to be able to pre-position some of that, particularly at some of our high volume buildings and facilities so that they can be used daily. And so we have those in place either on hand or through third-party contracts at police, fire, municipal court, and the international bridges. The other service that we've started is on-demand fogging and spraying. So if a department finds an area that's of concern, they can call facilities and we can provide same-day service. Next chart. Again, all of our return to work plans and guidelines have been completed for a return when that is announced, with the exception of the facility modifications that are ongoing at this time. Next chart. And lastly, the facilities team's done a great job. Been working every day of every week in getting our facilities modified so that our employees will feel safe and confident when they return to work. It's a long process. We're getting done about 2 to 3 buildings between doing the assessment and the modifications each week, and they're doing a great job, and we're making a lot of progress. Next chart. And so that concludes the cross-functional team update to the council today, and I'll turn it over to the city manager for any closing comments that he might have.
First of all, I want to acknowledge all the work of the cross-functional team. They've done an amazing job. I think it really demonstrates the benefits of having a cross-functional team in place. I know there's been some questions for some reason about that. A lot of folks, whether it's in the community or the council itself, has had questions about that process. But everything we do is based on breaking down silos. I know that's been a priority for the council. And I think this demonstrates the benefits of having all these different partners and all these different folks in the organization with different skill set and different talents, and it really has brought out the best in what they offer. The dashboard is a very good example of that. That happened because of some of the work that I'll talk about later in our LSS team, Roman Sanchez and Cesar Grado, and working with UMC. Again, I'll talk about that later. But what I wanted to do first is clear up some confusion. I know that there was some information put out by the CDC with regard to, last week in referencing testing, that we are not changing our strategy. I want to make that clear to the community. Wanted you to have this so that we're all on the same page. The Department of Health are clarifying for what was kind of put out nationally is that the Department of Public Health continues to offer COVID-19 testing free of charge for persons with or without symptoms for diagnostic and community surveillance purposes. Again, the Department of Public Health continues to offer COVID-19 testing free of charge for persons with or without symptoms for diagnostic and community surveillance purposes. And as we reported today, we have another city site that we put in place because that was requested. We have enough for the capacity, but geographically, I mean, it's important for us to meet those needs as well. So those individuals that are showing symptoms or believe they have been exposed to a COVID-19 positive person, whether or not that person was displaying symptoms, are strongly encouraged to be tested. So I just wanted to make that a clarifying statement because 1 in 4 positive cases in El Paso County do not show symptoms. So it's important for everyone to be tested if they suspect they've been exposed. Today, you've heard about the testing and how we've expanded that with the new site, but we also have heard about partnerships. We have focused on not only the testing part, but adding partners, and we've briefed that today, working with the business community, working with the medical community. The community task force, as an example, we stood that up after a discussion with the county that we reached out to them on, and then we came back and reported to the council. So the cross-functional concept really works not only within our organization, but outside the organization. And that innovation took place really, with the integration of a lot of what we do into the state. So we've integrated our internal best practice, our Lean Six Sigma integration into the testing sites. Roman Sanchez and Cesar Grado led this and partnered with UMC and wanted to make that clear with the council how that was fleshed out. Another example of growing the role and impact of our Communities of Excellence work is what this demonstrates. You might recall we have talked to the council that about 15 community organizations met and partnered and reached out. We reached out to them in September of 2018. I believe the mayor was involved with that. So was Representative Hernandez, and so was Mayor Pro Tem at the time, Ordaz. This is a great example of how beneficial that reach out was with the Communities of Excellence concept. We've done other work in that respect that we've had tremendous success with. So it's also how we are not just sitting back. I think that's the other message today, and saying that these sites are run by the state. They are run by the state. They do have third-party contracts with these groups, but we have taken ownership of these. We've gone out and shown them how to run these the best way possible, not to tell them, hey, we know best, but we want to make sure that we give them insightful recommendations that are compelling. And as you all know, you've had all these briefings on LSS before, and you know that process and that data compels. It compels you with strong data that comes directly from the people that do the work. So we've exposed the state to that process, and we've gotten that benefit out of it. I think another benefit of the Communities of Excellence and the cross-functional team benefit is, as I've mentioned, the Power Dashboards. We've compiled all this data in Power Dashboards. And yes, we have previewed it with Dr. Alozzi, and who is the other co-chair, along with our own Dr. Ocaranza and the county on Thursday, and they loved it. So as this will show you, we are working assiduously to meet and surpass the community's expectations. We've been taking copious notes throughout this whole process, and we keep making the process better and following up on what we hear. So hopefully you have heard that, you have seen that, and you are touching that. You're out there and seeing it, because there's a lot of information that's being put out that's not good information. People have to be responsible with the data. I know that Dion, if she wants to jump on right now, she was telling me that they were doing some best practice comparisons on the number of citations, and the number of citations that have been put out is a lot higher than what some have reported. So I think, people that don't have the right information and put it out irresponsibly, it's really not good for the community to get information that's not accurate. So we feel like, as soon as we have the information that's accurate, we provide it to the community. It's important to do that. So Dion, if you want to maybe share that piece of information with the council, that would be helpful.
Sure. Dion Mack, Deputy City Manager. I was just following up on some comparison data. I think as we discussed when we were about to put our information online regarding education and compliance, we did take the opportunity to look at San Antonio and others regarding their numbers. We did have some reports come out regarding our efforts in terms of compliance. When you look at San Antonio, they have 12,000 visits currently, 12,000 visits currently on their website that are related to compliance, and we're at 18,000. So it shows that our teams, in terms of our compliance task force, are out there in the community. They are reaching out. They're, yes, working with our communities in terms of citations, but even the total number of citations aren't that different compared to a city that's much, much larger than us. We have 119 citations that are pending in court. As you saw in the presentation earlier, There were a few that were deleted because of lack of compliance with the actual ordinance. And San Antonio's mass gatherings are at about 137. So just, we are serving our community to the best of our ability, always understanding that there's more that we could be doing, listening to our constituents as we heard today. There's still opportunities for improvement as we move forward. But I do think it's important to recognize that these teams are continuing to serve our community to the best of our ability and are very concerned about the health and safety of everyone who lives within the city
and
county of
Dion,
El Paso.
and Dion, just for the record, isn't San Antonio almost twice the size of El Paso in terms of population?
Yes, sir. Yes, sir. Thank you.
Mayor, that concludes our presentation. As you can see, we're working feverishly to ensure that we're answering all the questions and then we're providing the best information on this issue and listening to the council and making sure that the concerns that you hear from your constituents, that we're addressing them, and that not only are we addressing them, but we're surpassing the expectations. I know this is a dreadful disease, dreadful virus that has a lot of folks concerned. And I hope that after hearing what we presented, the council understands and feels that we're taking it very seriously, we're working it from all angles, and that the community feels the same way, that we're working it on all fronts.
Representative Hernandez has a question.
Thank you everyone for the presentation. For the Instagram, the Buy El Paso, I just wanted to give quick kudos. I followed you on Instagram, so I hope my colleagues will join me in doing that and sharing that on Facebook. Regarding the pedestrian wait times at the bridge, you had said 7 hours, Mr. Coronado, you had said 7 hours. Is that for vehicular? And what is it for pedestrian wait times?
Yeah, so we've heard anywhere between 4 to 7 to 8 hours on the vehicle side. I've not been able to actually check that using their system, the way that that is reported. Right now, we are seeing drops in crossings for vehicles and a small uptick on the pedestrian side. So people are switching modes, right? It typically happens when something like this happens on the vehicle side, they switch to pedestrian mode. So to answer your question, I don't have wait times for the pedestrian side. I'll look into that. But again, 4 to 8 hours on the vehicle side.
Okay, yeah, sure, that's fine. I couldn't find it. So if you could just send me an email
Sure.
with the average times, please. I do get these questions. What's that?
No, we'll look into it for sure.
Okay, thank you. And then in terms of the dashboard, I just really wanted to thank the information that's been provided. It's really great. I think that I need to review the different levels thoroughly. I wasn't able to see them from the presentation. And so when I click on, and maybe you can refer me to which page on the presentation it's on. There's just so many slides.
It's not out yet, ma'am. So what I can do is send Mayor and Council the link to the dashboard. It's being presented right now to county commissioners. So they'll have an opportunity to see it right after lunch hour. And so I'll send you the interactive link so you all can take an opportunity to go through that.
And then in terms of the stages, the community scorecard, can you refer me to like a PDF, or can you send a PDF document so that I can
blow it up?
Yeah, review it and look at it closer.
Sure.
But thank you for doing that. I think it's a really great dashboard. I have seen complaints in the past regarding the dashboards, it not being available, and I'm not sure if it has to do with the Java manuscript, like if it's not downloaded or updated. So if somebody does not have access to the software to see that dashboard, is there like an image option or a narrative option? Like a screenshot, if you will.
I'll work with, I don't have the answer to that, ma'am. This is Dion. So I'll work with the communications team to see what we can do. I don't believe that we got that direct complaint when we had the other just individual charts. So I'll see what strategy we put in place for that and see what we can do. Okay.
Okay, great. Thank you.
Ma'am,
So,
this is Laura Cruz with this is Laura Cruz, Strategic Communications Director. Yes, we can certainly do a static display for those individuals. If that was the case we were having with one of our IT vendors, but it had been resolved. So any issues that we come up with, we can work with IT to come up with an alternative option.
Okay. All right. I haven't seen the complaints recently. I'm just curious if it's going to happen with the same dashboard, the same problems we saw in the past. But thank you. If I get any complaints, I'll definitely let you all know. And then, Mr. Gonzalez, I did want to thank you for reaching out to one of my constituents on my request, who unfortunately his father had passed. And so what I took from that conversation, I think is very powerful. I think that along the way, we have placed so much emphasis on testing and on tracking. And now the question becomes, with the 400 deaths, what are we doing as a city to ensure that those families who have been affected by COVID-19, whether it's through death or through employment, what have you, that we really think about a strategy to support them and to identify CARES Act dollars to support something similar to like a resilience center. And a lot of the questions and concerns I got were really simple. And I feel like I know these things, but the average population, they don't really have the information on how to request that certificate. They don't know how to get counseling services. And so the concerns I heard from this constituent, especially being from out of state, trying to help his father, I really think that we need to consider, and I asked my colleagues to join me in considering a COVID-19 resilience center. I know there's one already in place for the victims of August 3rd, and so I'm not sure if that facility could be expanded to support, and if it's not that facility, long-term looking at other sites. But I think that is the missing key here. The missing part to our conversation is how do we better support those families that have been impacted? And so I know the county has been supporting those families through helping with funeral costs. But I think there's just so many other ways that we can have a one-stop shop center for these families that have been directly impacted. And so I wanted to share that with you because that's something I'd like to explore further. You had meant, and throughout the presentations, it was discussed that there's additional dollars on the table for economic development, but I'd like to really see dollars set aside specifically for the post-death or post-COVID contracting COVID-19. How do we better support those individuals? So I just wanted to state that and say thank you, Mr. Gonzalez, for reaching out to that constituent.
Yes, ma'am. Do you mind if I share with council kind of what that constituent was concerned about?
Yeah, sure, absolutely.
Okay, so Mayor and council, what we did is we reached out to this gentleman, and I think it's the same one. You said out of state. He said he was, maybe I think he was somewhere, he's in San Antonio, right?
Yeah, out of city, I meant, I'm sorry.
Right, yes, ma'am. So, and I didn't mean to correct you. I just wanted to make sure we're talking about the same one. We called them. I called them. Dr. Carranza was on the phone. Angela Mora. So was Mario D'Agostino and Laura Cruz Acosta. I believe that was everybody who was on the call. And what he was sharing with us was very insightful, and it was similar to what Representative Hernandez is talking about. In that, he did talk about some of the things she mentioned, but what I gathered from it is that he was referring to the whole unfortunate process when someone does contract COVID and whether or not you can see them, the whole idea about the bedside manner, the not being able to see them, how cruel it is, how difficult it is there at the end. I mean, we can all just imagine if that was our loved one and you can't go in there and hold their hand, you can't go in there and do any of these things. And so the unfortunate part about this virus and the way it's attacked communities is that it attacks the whole community. So you really need just like one sole source to be able to like be in control. And because we have those partnerships that I mentioned earlier, it's easier for us to maybe reach out to these hospitals and talk to them about some of these concerns that were shared. Some of it did include also costs associated with burials and things of that nature. I know that I asked Laura Cruz Acosta about some of the charities that have been stood up and or that were already doing something in another area and are attempting to be helpful there as well, and that being something good to donate money towards as well. So the idea, the discussion, and the point that you're making, I think, is a good one in terms of the unfortunate evolution of this virus and how we can attack and how we can support our community on all fronts as best as we can, because this is having a huge impact across not only El Paso, obviously, but across the state and across America. We could be a standard bearer on how we could be helpful to the community. So yeah, we'll look at what we can do, how we can reach out to the hospitals at that level, how we can reach out. How we can reach out. Someone's okay. How we can reach out to the funeral homes, and how we can reach out to charities, and how we can possibly look at the CARES funding and how that's been allocated already. If you remember, the council voted on that. We'll see if there's any wiggle room in some of the areas, because in the things that y'all approved, in some cases, we are getting some responses back, and don't quote me on this, but there are some areas that maybe couldn't spend the money or couldn't get it done quick enough. And so maybe if we can reallocate that, we would definitely come back and share that with the council with a different game plan. So I'll talk to staff, and we'll sit down and see what we can come up with, because I do think it's a good idea. And the gentleman was very obviously emotional, but he was very very helpful too, because he was really trying very hard to provide some data points that could be helpful to us going forward. So it was difficult for him to do that. So I applaud him for that. And again, he was very thoughtful in what he said. I was actually very surprised. I didn't know what I was going to hear, in terms, if someone, when you lose a loved one, you're very distraught, very upset, but he was very helpful in the feedback that he gave us.
Right. And so my hope is that we can continue this conversation, Mr. Gonzalez, because I think that's what we're hearing, just kind of bits and pieces through social media, through the media, and through family members, that really this is unprecedented times. And if there's anything that we can do to just lend a hand or support, I think that goes a long way to get that trust and back from the community, that we're here to help, not just test, not just to trace, but also to be that support system. If not the city, then maybe working with a nonprofit who can better provide the services. So thank you for taking that call. It means a lot to me and to our constituents. And so I hope that we can continue that conversation. I don't have any other questions. I just wanted to thank everyone for their time. And I did want to mention that I did get tested last week at the EPCC location, because I try to go frequently to monitor how long it takes to get the test back. And so I did get it back within 48 hours. And so I have seen a better response from that state contractor, ONU. And so I'm very pleased with that.
Were you exposed or showing symptoms?
No, I was not.
No. Well, see, that's a good example of, you don't have to be exposed, you don't have to be showing symptoms, but you never know when you're around someone and you can still take it. And that's proof that people can go out and still be tested.
Right. And so for items 2 and 3, I do have questions related to the ordinance, but I'll just wait to ask those questions, because I think I've already went over my 10 minutes.
One other thing if you don't mind, one other thing I wanted to share with you, Council, is the fact that as we pointed out with this gentleman from San Antonio and his father who passed away here, we are helping on all the different fronts, as Ms. Hernandez pointed out, with regard to economic development, education with the businesses, helping the nonprofits, helping the community as a whole, the council stepping up with no increase in the tax rate, providing relief in so many ways. But I do think it's a good idea for us to look at how can we help in those latter stages, the unfortunate latter stages. So again, we'll come back with something. I'll sit down with staff and we'll report that back to the City Council.
Thank you.
Mayor Pro Tem has a question. Before he does, I want to remind everybody that Operation Hope is doing funerals on COVID deaths free of charge. So like they did for our August 3rd shooting. I've been by the Family Resilience Center. If you haven't been by, I encourage you to go by. I do think we need to talk to the United Way, but I do think there's a way that that would fit in and mesh in with these this mental health issues and support. So we'll follow up with United Way on that. Representative Schwartzbein.
Thank you, Mayor, for pointing that out, the Operation Hope.
Thanks. I'll just list out my questions first. On slide 58, relating to the TABC suspensions, when a bar that's suspended, what does it actually mean? Are they still able to serve food? Are they still able to be open and not provide alcohol? There also is, I guess on the slide as well, it lists the date started and the date ends on different businesses. And then on the box next to it, it states the number of days, 60 and 45. It doesn't completely line up, so I'm wondering how that can be, if it could be explained further about that. Slide 73, is there any other potential locations that staff thinks would be appropriate to do this partial street closure or pedestrian opportunities? And then on slide 8, I have a number of questions about amending the ordinance in terms of the time, and then also having in-person meetings at the convention center. But I guess we'll be addressing that more in detail with agenda item 2 or 3. Would that be correct? The reenacting of the emergency ordinance?
That is correct.
Okay, so then I'll hold my questions for that as well. And then on slide 5, it talks about and I don't know exactly if slide 5 is appropriate. David Coronado talked about it a little bit about these long wait times. There's an article from the NBC San Diego that talks about secondary inspections will be conducted on those who are suspected of traveling for an unnecessary reason. And that's both by U.S. citizens and not. This might be a question to you, Mayor, in terms of this, essentially what is harassment of U.S. citizens and non-U.S. citizens traveling between the border. What is our strategy or plan? Have we reached out to our federal representatives, both in Congress and in the Senate? Are you looking at writing a letter, or what is your sort of, or what is the city's position on communicating how damaging it is to essentially harass travelers on our ports of entry, whether they're U.S. citizens or not? And,
Mayor, can I ask?
Let me answer this. Let me say something.
Can I answer the first question first, if you don't mind?
Okay.
So, Mayor Pro Tem, with regard to the item about in-person meetings, the thought was that the council had asked questions before about when we're going to get back in line in terms of services and things of that nature, and really felt like because of the numbers that we've been reporting.
Let's just save that one to the agenda.
For agenda 2 or 3, because I only have 10 minutes here, and I'm sure we can talk about it more then. So, thank you, Tommy.
Mayor Pro Tem, to answer your question related to the bridges and CBP, I was called by the CBP a week ago to tell me what they were doing. But the way it was characterized to me that this was a derivative of a survey that was requested by our Congresswoman on verifying who's essential and not essential. I don't think it's a harassment as much as it is verification. Are you, irrespective of the fact that you can travel back and forth, are you doing it for non-essential things? They talked about how people were going back and forth for haircuts and different things, and that there was some concern over that. So based on that and conversation with our Congresswoman before they had conversation with me as how they arrived at what they're doing. He did warn me about the delays, and we're analyzing that. And as David Coronado said, we're going to go back to them and talk about where they are. But this was a derivative of a conversation and a survey requested by our Congresswoman and related to who is essential or essential travel versus non-essential travel, irrespective of whether you have a green card or a citizen or whatever. I would not characterize it as harassment. I'd characterize it as verification. So that's the best answer I can give you until we get into this from that.
All right, I appreciate that. Thank you, Mayor.
All right. Okay. You have more questions?
No, I didn't. I listed the questions, the TABC, slide 58, slide 73, and then we could talk about the slide 8 about the amending of the emergency ordinance at the second, during those agenda items.
Okay. All right. If there's nothing else here from anyone, then let's move on to item number 2.
I would like to be, I was hoping to have a response from those questions about the
I'm sorry.
Yeah.
Can someone answer Mayor Pro Tem's questions?
Yeah, Mayor, there's Peter Pasillas, Police Department.
Okay.
Okay, I'm transmitting. As far as the suspension dates and those businesses, those are the dates that are given to us by TABC on their orders. As far as it goes, the suspension is for the license of the alcoholic serving or providing alcohol. As far as it goes, that's what TABC regulates. As far as it goes, we will check we'll go back and recheck those dates, but those are the dates that are on the orders from TABC.
So, for example, Rocking Cigar Bar, 226 Cincinnati has a 60-day suspension, but the date began and date ends is 30 days, correct?
Yes, sir. Yes, sir.
So we don't know which one is valid on that.
Correct. Yeah, and we'll get back with the TABC. These are on their orders.
And then, so for example, just going with that business, just because I'm looking at it, they would still be able to be open, hypothetically serving food and non-alcoholic beverages, correct?
Correct.
Okay. Because we get questions about why this place is open or that place is open, and I'm assuming people are going to be seeing this, and so they'll be asking questions. So thank you for clarifying that.
And the orders are issued to the directly also to the business by TABC, so they know exactly what they can and can't do.
Okay. And then I just had one other question on slide 73 about other potential locations that staff might think would warrant these enhanced street closures and pedestrian opportunities.
Yes, Representative, this is Alex Huffman with CID. We are looking at additional locations. There's a number of opportunities that exist, partially because these projects are looking at being temporary. And so we would be definitely looking to change locations over time. But we would be able to, identify future locations as well for other projects that have not yet been identified. And so, that's something that we can definitely work with you on.
Yeah. And in terms of some of the equipment for the closure, the barricades, and that cost would be borne by the business owners or the group of business owners, or would there be a grant or anything that they could apply to for the city with CARES Act funding to compensate those closures?
So one of the things that we're looking at, that if council does approve that, would be that the city would be using CARES funding to purchase their own traffic control equipment. And so assuming that it's available, once we deploy the pilot projects that we've identified, that would potentially be available for private business owners to work with the city in procuring. But otherwise, yes, it would be incumbent on the private property owners to secure their own traffic control equipment to do some type of improvement that we've identified in the pilot program.
Okay. Thank you. Thank you, everybody, for your hard work.
Representative Bonello?
Yeah, thank you. I don't remember who did the presentation. I think it was maybe Carrie on the reopening of libraries. Maybe this is an HR question, but I know that recently we sent out a recruitment notice for 2 temporary part-time library customer service specialists. I do understand why the temporary positions are not in the best interest of our furlough positions, but my question is, why are we looking for temporary positions when we reopen the libraries rather than taking the opportunity to, onboard 2 of our employees that are currently furloughed?
Certainly. Representative Anello, this is Claudia Lujan, Interim HR Director for the record. The positions were specified in the grant monies that we received from the Texas State Library and Archives. It specifically required that we hire 2 temporaries unbenefited at 30 hours apiece.
And this, I guess I'm just confused about why that is.
It was the grant that the library received. It was specific in the acquisition of the grant. We didn't have any flexibility in creating it as a full-time position.
Okay, and was this grant applied for pre-COVID and prior to the furloughs?
I'm not certain when the department applied for it.
Good afternoon, this is Nora with the libraries. And yes, this was applied pre-COVID. This is an annual grant applications that we submit. And we had requested 2 temporary grant positions.
Okay, thank you.
You're welcome.
If that's it, let's move to item number 2.
Item number 2 is discussion and action on an emergency ordinance reenacting emergency ordinance number 019035, extending a disaster declaration due to a public health emergency.
Is there a motion to approve?
Mayor, I have a question. Is this the item that would be amending the meeting in person as well as the times? Or is that the following agenda item?
Representative Schwarzheim, this is Carla Neiman. That would be item number 3. Item number 2 is the simplest of the 2. It is simply extending the emergency declaration for another 30 days.
Okay.
And remember that this requires a unanimous approval of council and the consent of the mayor.
All right, move to approve.
Second.
We have a motion and a second. Is there anything you want to add to this, either Mario or Carla?
I have a question, Mayor.
Have anything else?
Is that Representative Hernandez? Who has a question?
Laura, it's Sandra.
Okay.
Will the adoption of this emergency ordinance, Mrs. Neiman, does that automatically ratify item 3 for the amendment?
No, ma'am. So you all have been running these concurrently, every council. This will expire on September 30th. Traditionally, we ask that you vote for them together, but because we have an addition on item number 3, we will discuss that separately.
Okay, so the action right now doesn't solidify the next action.
No, it does not. So remember that this is simply to extend the disaster declaration. Okay. Item number 3 is a separate emergency ordinance.
Thanks.
Okay, if there are no further questions, let's go ahead and vote.
There is a motion and a second to approve item number 2. On that motion, Mayor Pro Tem Schwarzbein.
Yes.
Representative Anello.
Aye.
Hernandez.
Yes.
Morgan.
Yes.
Salcido.
Aye.
Rodriguez.
Yes.
Rivera.
Aye.
Lizarraga.
Aye.
Mayor, do you consent?
Yes, I do.
The motion passes unanimously. Item number 3 is discussion and action on an emergency ordinance reenacting and amending emergency ordinance number 019036 as amended and reenacted by emergency ordinance number 019062 and further amended by emergency ordinance number 019068.
I need a motion to approve.
Motion to approve.
Is there a second?
Second.
Okay, let's have some discussion here on presentation.
Mayor and Council, this is your traditional emergency ordinance that you have passed the last several months. It is here up for reenactment, and what we have proposed for Council's consideration is that Section 4 of the ordinance be amended to allow for suspension and modification of ordinances and rules. And the addition that we are requesting is that the resolution amending the rules of order for the City Council, which were revised on March 3rd, 2020, be amended to allow for a temporary suspension and of the City Council meetings from 9 a.m. to move them to 4:30 p.m. And then we also would move call to the public from noon to 6 p.m. We are doing this at the request of some of the members of council and our staff, who, as you know, are currently homeschooling all of our children, and it's easier for our staff and some of our council members to have the meeting start at 4:30 in the evening. We are also requesting that the meetings take place in person and that they be held at the convention center for the time being. That is the extent of the amendments.
With one exception, that it would function very similarly to the last meeting the council had in person, and that it would be very limited, and it would just simply be a transitioning then this would be the beginning of it, to attempting to get back in line on more frequenting of the office and things of that nature. The numbers have subsided some. We feel like it's a right time to start this process up again.
Yeah, and Tommy, we've also, since then, since the last meeting, have done a facility site assessment. We've had our facilities team in there looking at it. We've spoken with public health and the EOC with discussions about how we could do that and do it very safely.
Okay, Mayor Pro Tem.
I appreciate the work that staff has done on this. I also think too that there's, obviously an advantage towards helping staff as, I'm sorry, there's a dog barking, for helping staff as well as council in dealing with all the kids coming back to school. So I definitely understand the value in that. I am comfortable with changing the time to 4:30. I don't think it's appropriate right now to go and have those in-person meetings. And if that is something that is strong, I think at a bare minimum, City Council should be given the opportunity to also be able to be present virtually as well. City Manager was virtual during that meeting as well. I don't know why. I know our numbers have gone down, but everybody's expecting a spike with the fall coming in there and with flu season, which is right around the corner. So I'm not really sure what would be the benefit of having people in person, especially when you have council members that have pre-existing conditions that could lead to, a really bad situation with catching a COVID-19. So I would like to, if possible, amend the amendment to just have the 4:30 time there. So I guess it'd be a motion to amend the emergency ordinance number 019062 as amended to allow for work sessions and city council meetings to start at 4:30 p.m. and to delete the language relating to being held at the convention center.
Mayor Pro Tem, did you also say that you wanted to have council have the option of being virtual? Is that what you said?
Yeah. Yeah, but to be completely frank, I don't know why we would want to be having the meetings at the convention center in public right now when we do not know where the numbers are going to be in 60 days. And also what is the benefit of doing it in person, as well as the costs associated with preparing the convention center for those meetings every 2 weeks as well. There was a lot of work that was done to have the meeting there in person on August 18th. And I just, with furloughs that we've had and with, the budget constraints that we have, why would we be spending money to outfit the convention center twice a month? Well, 4 times a month for council meetings in person.
Mayor Pro Tem, this is Laura Prine. One of the benefits of the in-person meetings would be it would be easier to keep quorum. We're struggling to keep quorum with the virtual meetings as council members are continuously either having technical difficulties or they're turning off their cameras, and so that makes it very challenging for me to keep quorum. So that's one of the benefits of the in-person meetings. The last meeting that we had in person, I think, ran pretty efficiently. Everyone was separated more than 6 feet apart from each other, and so that's one of the benefits that I see of the in-person meetings.
Yeah, I understand that, but it doesn't seems to be a lot of work being done when we're don't know exactly what we're going to be going into with this fall season of flu and COVID-19.
Mayor Pro Tem, this is Laura Cruz Acosta. In terms of the costs associated in the efficiencies, the cost is minimal. It's not anything more than what exists right now, quite frankly. Oftentimes, the PIO's office will actually receive in-kind donations. We have been extraordinarily successful. The work that we do donated. So the cost is actually very minimal, considering that the convention center is actually our facility as well.
So how much does it cost?
It's under 2,000, I believe.
So $2,000 for every day?
No, it was at one-time cost, and I'm sure that it would actually reduce over a period of time dramatically.
And then just to add what you had stated earlier, Representative Schwartzbein, the logistics of getting it put together. We've also sorted that. We're able to leave a lot of that in place just because there are no other events that are happening right now. We actually did an evaluation not only of the convention center, we looked at the city council chambers, and even though there's been an install done at the city council chambers and the safety mechanisms have been put in place with plexiglass and those kinds of things, we felt like if we're evaluating both of those, that we could get very good social distancing at the convention center and be able to operate it in a safe environment.
Yeah.
It was done for safety reasons, because Carrie's right. The council chambers is ready to go. We just really felt like because of the issues you're bringing up right now, we wanted to be extra vigilant and careful and thoughtful, and felt like because of all the reasons he stated that the social distancing is a lot easier there at the convention center, that made more sense. And the setup fee was just a one-time setup fee, and then it stays like that until we break it down, and they're not having any events. So I'm just repeating what Carrie just said. But
no, I understand.
That's the thought. Yes, sir. That's the thought that went into it. I just want you to know that we just didn't haphazardly do it. The numbers, we said to the council from the very beginning, if our numbers ever started subsiding, because y'all have asked us publicly several times about when are we going to get back in line, which includes the council meetings. And so that's what this is a result of. That's all.
Yeah, I mean, I think in terms of being safe and extra vigilant, we have the opportunity with technology to have, to continue these virtual meetings in a way that can protect the public, can protect staff, and can protect council and mayor, especially dealing with comorbidities and pre-existing conditions.
If that's it, Mayor Pro Tem, then we go to Representative Hernandez, Representative Lizarraga, and then Representative Bonello in that order.
Thank you. Mayor Pro Tem Schwartzbein. I agree too that we should give the option to council members. I will be supporting that effort, but I also think that if your amendment passes to allow for your option virtual or in person, that the city manager and the city clerk reach out to determine like who wants to be in person. So if the majority want to be at home doing the meetings virtual, would it make sense to set up the convention center? But anyway, I just wanted to express my thanks to Mr. Gonzalez. It is a struggle to do all of this simultaneously with the children at home. So I think that this will set a clear message to the public that the city of El Paso is prioritizing families as well, and families with young children. So I thank you for being responsive But I too would feel more comfortable doing these meetings virtually. So that's my opinion. Thank you.
Representative Lizarraga.
Thank you, Mayor Margot. So my question is, this ordinance is for 60 days? Until when? Because it says September 30th.
Correct. I apologize. I was muted. The ordinance would be in place for 30 days. So this is part of your emergency ordinance. So you would need to renew this every 30 days as part of the current emergency ordinance.
Okay, so till September 30th for this.
Yes.
One. Thank you, Ms. Neiman.
Okay, Representative Anello.
Yeah, I want to say that I concur with Representative Schwarzbein and Hernandez. I think that there were a few technical difficulties. I think Representative Lizarraga as well as myself were sitting in the back. It was sometimes hard to see the presentations and then to get on Teams. When we spoke, we had to take our masks off. I wasn't super comfortable with that. I also say that I don't have children, so I don't want to speak for any of the council members that do. But I do understand that school ends at 3:30, and so then having to finish school and then travel from their home to the meeting, I can imagine could be a little bit stressful. And I just think for right now, I think, revisiting, as Representative Lizarraga brought up, the ordinance is for 30 days, revisiting this idea in September 30th. I think I would prefer.
Dr. Morgan.
Thank you, sir. First of all, I want to thank the staff for all their hard work, but I'm going to have to echo the same as my colleagues here. Yes, the numbers are going down somewhat, but at the same time, I believe that we should have the option because, as Representative Schwarzbein has stated, we do have council members that do have underlying conditions, with me being one of them. And I do a lot to keep myself healthy and safe. But, this is something that I believe that, if we do it, we should have the option to go virtual versus being there. Thank you.
Ms. Neiman, do you have any comments before we've had a motion, but no second, but before we decide?
Hold on, Mayor. I text you, Mayor. I text you, Mayor.
I didn't see that. Representative Rivera, go ahead. I did not receive that. Sorry.
Thank you, Mayor. I would a lot of great points have been brought out by my colleagues here. We did have problems, like Representative Ranello said during that council meeting at the convention center. But all in all, I agree with what's being said by my colleagues, and I also have to say that I really, for one, don't want to send mixed messages to our public when we're wanting them to stay home and stay safe, and we're meeting. Okay, so with I believe that right now with this virtual meetings that we're having, we have been working well. Everybody has clear sight of the presentations. Clear communication with the individual person that we're speaking to, and operating this remotely. This is the new normal, and we've been doing a great job as far as I'm concerned. Sure, there's technical difficulties here and there, but who doesn't have those problems? Again, I think this would send a wrong message to the public, and I agree with the Mayor Pro Tem on this issue and everybody else that has spoken. Thank you, Mayor.
Ms. Neiman, do you have anything to add?
Mayor and Council, the proposed amendment to the emergency ordinance only mentions the times that are being moved from 9 to 4:30 and 12 to 6. There is a reference on the last whereas to the convention center, but that is not binding. Either way, if Council doesn't choose to have the meetings at the convention center, we will continue to hold them virtually, and we will make that change on that last whereas.
Yes, ma'am.
So do we need to vote?
Correct.
Vote? How do we need to vote, Carla?
The vote will still have to be unanimous to change the time from 9 to 4:30, and then the 12 o'clock noon call to the public to 6 p.m.
So we vote on this and it still accomplishes if people do not want to meet in person, we
Correct. In anticipation.
we don't need Mayor Pro Tem's amendment. Is that what you're saying?
Correct. So in anticipation of you all not wanting to move the place of the meeting, that language is not in the actual language or body of the ordinance. It is mentioned in the recital, but recitals are not binding. However, out of an abundance of caution, my staff will remove the word convention center and say will be held virtually starting at 4:30 on Mondays and Tuesdays respectively. And then the language will remain the same in paragraphs 1 and 2.
I will be happy to hear that if you remove that, like you say you will, if you remove the convention center. And if you still need Mayor Pro Tem's amendment, I'll second it.
There is no need for an amendment.
There is no need.
Okay.
But you do need to have a unanimous vote of council and the consent of the mayor for this emergency ordinance to pass.
Okay, does everybody understand that? We're voting on changing the time to 4:30 for the start of the meeting and public comment to 6 p.m. Okay?
And removing the language, sir.
Carla?
Point of clarification. I have a point of clarification for Attorney Neiman. I just want to clarify because we keep saying council meeting. Does this also include the Monday work sessions or any posted meeting? Okay.
Correct. So the last whereas states that it will allow for work sessions and city council meetings to be held at the convention center. We will be changing that to say to be held virtually starting at 4:30 p.m. on Mondays and Tuesdays respectively. That is traditionally when you all meet. If there is a special meeting of council, that is also done virtually at the time, or however council wishes to do that special meeting if necessary.
And the 6 o'clock is in reference to citizen comment, right, Carla?
Public comment.
Yes, it's called to the public, will be moved from 12 to 6 p.m.
Okay. Representative Rodriguez has a question.
Hi, I just want to say thank you all for doing this, for accommodating the parents like this. It's really helpful. But I guess my comment is, if we're not going to be meeting in person, is it necessary to start the meeting so late at 4:30? I mean, that was the whole purpose of it starting at 4:30, was to give us time to travel. Is it still necessary that it starts at 4:30? Maybe now I could start an hour earlier at 3:30. I don't know.
From a staff standpoint, we're good with that. I was just saying from a staff standpoint, we're good with that. We were simply attempting to accommodate the needs of our, members that have family. And so, yes, if 3:30 works for the council, that works for us.
I concur with that, Representative Rodriguez. I'm sorry to interrupt. I just wanted to say I think 3:30 works for me as well.
My only concern is that would we still continue the public comment at 6 p.m.? Because if people are for some reason traveling to work, they'd still have time to sign in. Will we still continue to have public comment at 6 p.m.?
That's up to the council. I mean, if for some reason, not that it would happen anytime soon, that a council meeting would be finished in an hour, but if it does happen and you finish early, we would have to just simply log back on.
Just like we do now.
Yeah, exactly. So 6 o'clock is fine unless y'all want to move it earlier, but 6 o'clock works for us as well.
Okay, I think 6 p.m. is a good time.
All right. Carla, you want to comment on the changes, or are we going to automatically change it to 3:30, or do we need this as a motion? What do we need to do?
We need a motion to amend the current proposal so that the reference from 4:30 be to 3:30 in section 4 of the ordinance.
Claudia, will you make that motion?
Yes, I'd like to make a motion to approve change the time from 4:30 to 3:30.
Second.
Okay, so we vote on the amendment first, and then we vote on the entire motion. Is that correct?
Yes, sir.
Okay. We have a motion and a second. Laura, let's vote.
Okay, there is a motion and a second to amend section 4 to change the starting time from 4:30 to 3:30 p.m. On that amendment, Mayor Pro Tem Schwartzbein.
I'm just here for a point of clarification. We don't need to amend for the removal of the language relating to virtual meetings in the convention center.
That's correct. You don't need to do that because the whereases are not binding on the ordinance. They are simply recitals.
Okay, great. Aye.
Representative Anello.
Aye.
Hernandez.
Yes.
Morgan.
Yes.
Salcido. Representative Salcido, I think you're muted, ma'am. Rodriguez.
Yes.
Rivera.
And for purposes of clarification, you are going to translate that convention center to virtual meetings, correct?
She just said that, Henry. Yes.
Okay. All right. Just making sure, Mayor. Thank you.
I know.
Aye.
I understand.
Lizarraga.
Aye.
And the motion passes unanimously.
Do you need my consent on this amendment?
Not on the amendment. Oh, we do? Do you consent, Mayor?
I do.
Thank you.
Mayor and council, in order for the council to see this is the proposed amendment, it is now held virtually starting at 3:30. Do you see that last whereas?
Yes.
And then number 2 of the proposed ordinance now references 3:30 p.m.
Thank you, Ms. Neiman.
Thank you.
Okay, let's do a motion and a vote on the amended motion. Amended motion, yeah.
We did have a motion from Representative Morgan, seconded by Representative Salcido to approve the ordinance.
Okay, let's vote.
And this is to approve as amended. Mayor Pro Tem Schwartzbein.
Aye.
Representative Anello.
Aye.
Hernandez.
Yes.
Morgan.
Yes.
Salcido.
Aye.
Rodriguez.
Yes.
Rivera.
Aye.
Lizarraga.
Aye.
Mayor, do you consent?
I consent, and also with a caveat that says, I think everybody is better looking in person than they are on the screen, so that's what I was looking for.
Thank you.
Okay.
The motion passes
Number
unanimous.
4.
Item number 4 is discussion and action on an emergency ordinance instituting emergency measures to allow temporary uses on the private right-of-way and private property by suspending various city ordinances.
Move to approve.
Second.
Do we need any further discussion on this? Let's vote.
There is a motion and a second to approve item number 4. On that motion, Mayor Pro Tem Schwartzbein.
Aye.
Representative Anello.
Aye.
Hernandez.
Yes.
Morgan.
Yes.
Salcido.
Aye.
Rodriguez.
Yes.
Rivera.
Aye.
Lizarraga.
Aye.
Mayor, do you consent?
I consent.
Thank you. The motion passes unanimously.
Number 5.
Number 5.
We had already discussed, haven't we, with through the focus group?
Number 6. Can we move to number 6?
Okay.
Yes, ma'am.
Thank you.
Let me ask Henry, Representative Rivera, can I ask you a question? With number 5 covering it's the same as your 24.8, are you going to remove that tomorrow? On the regular agenda, your 24.8 is the same.
I'll leave it on there, sir, for I believe other callers that want to join in tomorrow.
Okay. Let's move to number 6.
Item number 6 is discussion and action on a resolution to authorize the city manager to sign a third amendment to the field site lease by and between the City of El Paso and Southwest Airlines Company.
Is there a motion to approve?
So moved.
Move to approve.
Second.
Second.
All right, let's vote.
There is a motion and a second to approve item number 6. Mayor Pro Tem Schwartzbein.
Aye.
Representative Anello.
Aye.
Hernandez.
Yes.
Morgan.
Yes.
Salcido.
Aye.
Rodriguez.
Yes.
Rivera.
Aye.
Lizarraga.
Aye.
The motion passes unanimously. Item number 7 is discussion and action on a resolution to authorize the city manager to sign a second amendment to air cargo building lease agreement between the City of El Paso and Southwest Airlines Company.
Motion to approve.
Second.
Second.
All right, let's vote.
There's a motion and a second to approve item number 7. On that motion, Mayor Pro Tem Schwartzbein.
Aye.
Representative Anello.
Aye.
Hernandez.
Yes.
Morgan.
Yes.
Salcido. Rodriguez.
Yes.
Rivera.
Aye.
Lizarraga.
Aye.
The motion passes unanimously. The last item is number 8. This is discussion and action on a resolution that the city manager be authorized to sign the first amendment to the subrecipient agreement between the City of El Paso and Lift Fund, Inc.
Move to approve.
Second.
Let's vote.
There's a motion and a second to approve item number 8. Mayor
Sorry,
Pro
I have questions, Mayor. I thought we were going to have the presentation. I guess we did discuss it. I don't know if anyone from Economic Development is here. You know, I do have concerns with this. I mentioned my concerns prior. The LIFT fund does allow for more than $5,000 in resources, whereas the other two funds in which we're moving them to don't. They cap at $5,000. And so, I mean, I don't know how comfortable I am with this. And looking at the presentation, you know, we're seeing a lot of really great testimonials about the LIFT fund. And so I was wondering if Economic Development had any additional information to help me be more comfortable with this.
Elizabeth Trix here with Economic Development. I'm happy to go through the presentation a bit and see if I can help answer some of those questions as I go through it. It's a very short presentation, but I think it'll clarify why we need to make this amendment.
I mean, that's fine. I've looked through the presentation, and I know that you and I have spoken one-on-one. I still have the concerns that I have, but yeah, go ahead.
Okay. So this amendment, what it does is it allows us to adjust the grant amount. Originally, the grant amount was for $523,800 in CARES funding to LIFT Fund. And the purpose was intended to provide financial assistance in the form of micro grants. In this case, it was $5,000 to eligible small businesses negatively impacted by COVID-19 that were still in queue from the first round of funding. And Miranda talked a bit about that in item 1. Ultimately, there were 96 businesses that were in that queue, which is how we arrived at the amount of $523,800 for the original grant amount. However, once LIFT Fund, once this agreement was executed and LIFT Fund did their due diligence process of ensuring that, you know, all those businesses were qualified, they found that 50 businesses were qualified, which is great news because that's 50 businesses that needed cash grants and received cash grants in the amount of $5,000 each. You know, the testimonials here show that they did a lot of good. We have many, many more testimonials. That being said, though, there are remaining funds in the amount of $250,000 that were not expended, again, because those businesses on the original list were not eligible to receive the funding. And just so that we know, it wasn't a case of businesses having shut down. There were two that was the case for, but the majority had actually seen an increase in revenue compared to last year. So that disqualified them from receiving the grant. So what we wanted to do is amend this agreement to have the grant amount reflect what was actually expended, which was $270,000. Remaining is $250,000, which, you know, if this amendment is accepted, can be reallocated into other programs. Next slide, please.
So the other two programs, we heard both Ben and Alex speak about them before, that we're looking at for the dollars that can be reallocated, are the operational support program, which supports nonprofit arts and cultural organizations suffering losses due to COVID-19. We heard from Ben that supports about 60 employees, those organizations together, as well as 1,600 artists that, you know, participate in those programs. So it's a really good opportunity to use these dollars that are left over for grants to those organizations. And then the second program that we heard Alex talk about was Sun City Safe, which allows us to use the right-of-way to promote safe distancing practices, but at the same time to increase business capacity for those negatively impacted by COVID-19, which oftentimes we think of those businesses primarily being restaurants and those sorts of things. The big expense here is not so much the permit costs or those sorts of things, but it's the barricade equipment. And so what CID has proposed is that the city purchase the barricade equipment using a portion of these dollars that are left over from this agreement. And then those that equipment can then be lent out to the businesses who qualify for this program, so that they don't have to incur that cost of the barricade equipment. And so those are our thoughts. It's just really important, though, that we unencumber the funds before we go about reallocating them. At the same time, what I do want to say is that, as Miranda mentioned, there are 3 other organizations, Lift Fund being one, People Fund and Project Vida, which were granted a total amount of $13.5 million from the CARES Act to deploy in the form of small business grants to different segments of small businesses. So People Fund focusing on the independent contractors and sole proprietors who have no employees. They are looking at $5,000 grants to eligible businesses in that segment. Project Vida is focusing on micro enterprises, so defined as between 1 and 4 employees. Again, $5,000 grants to those businesses. And then People Fund is looking at small businesses, but larger relative to the other two. So they're small businesses that have between 5 and 20 employees. Because they are looking at these businesses relative to the other two definitions, they are looking at doing grants of between $5,000 and $25,000. Again, however, it's based on need and it's based on showing the loss. And so that's why there's a larger grant allowable under the People Fund program. And that's, I hope that answers questions, but I'm happy to take any others.
I have a few more. So the 96 businesses were from the first time the Lift Fund was opened, correct?
Yes, ma'am, that's correct.
Okay, and so we never opened the application after, once we put these CARES dollars towards it.
That's right.
Okay, and so that's where my biggest concern is, because I heard from so many business owners that, you know, Lift Fund crashed out or the applications were full and they weren't able to apply. And now it's, you know, it's hard to be finding out that they actually will never have the opportunity to apply again because we're moving the money out of this fund. I also, while I think, you know, the right-of-way program is great, it's only helping businesses in very specific areas. And I don't believe that CARES Act dollars should be used for this initiative. So I'm not going to be supporting this. I really think that, you know, the Lift Fund is great. I don't think, you know, we all told individual businesses, you will have the opportunity to apply again. We're putting CARES Act dollars into these programs, and that's not coming. Now we're moving the money out, and that's not true. And so, yeah, I have a lot of concern with this.
No, I don't think so. That's not the case. So we didn't reopen the original round of funding because we ran out of funds. There are currently open 3 application periods, one of which is with Lift Fund. As I mentioned before, that's for grants, solely for grants in the amount of between $5,000 and $25,000 for businesses that have experienced losses and have between 5 and 20 employees. That application period is currently open and businesses can apply. The same is true of the People Fund as well as the Project Vida grant programs, which focus on different segments. Both of those application periods are also currently open and businesses can apply. Also, what I want to emphasize here is that we learned from the first round of funding that we need to do a lottery system, that the need is greater than the dollars that we have. And so it's really critical that we do a lottery system to ensure that it's not just first come, first serve, but that we have a fair way of deploying these funds. So I do, again, want to be really clear about that. There are 3 grant programs right now. They amount to $13.5 million, and all 3 application periods are open for businesses to apply.
Well, and Elizabeth, I think that you kind of just sealed the deal for me for not supporting this, because if there is so much need and we don't have enough dollars for the need that we have, I don't understand why we're moving money out of a program to help individual businesses set up on a right of way. So I'm not going to be supporting this today.
Let's vote.
There is a motion and a second to approve item number 8. On that motion, Mayor Pro Tem Schwartzbein.
Aye.
Representative Anello.
No.
Hernandez.
Yes.
Morgan.
Yes.
Salcido.
Aye.
Rodriguez.
Yes.
Rivera.
Aye.
Lizarraga.
Aye.
The motion passes with 7 affirmative votes. Representative Anello voting nay. The motion passes. Is there a motion to adjourn?
So moved.
Move to adjourn.
Second.
There's a motion and a second to adjourn the City Council work session. All in favor?
Aye.
Anyone
Aye.
opposed?
Yes.
And the work session for Monday, August 31st, 2020 is adjourned at 1:04 p.m.
Thank you. Goodbye.
Thank you all.
Tomorrow's a regular time, regular 9 o'clock, right?
Bye.
Yes, tomorrow will be 9 a.m.
Thank you, ma'am. Thank you. Bye-bye.
Thank you.